open us up, and then I can talk about the agenda.
Great. Well, thank you, everyone. It's great to see you all. Really enjoyed the conversation yesterday. I thought it was really generative and constructive, and look forward to more today. And so take it away, Diana.
Great. Thanks, everybody. And just want to echo David's points about what a good discussion in the afternoon folks had, even as it got late and the meeting was long. So thanks for coming back with more energy. And today we're going to be focusing on those other three priorities, thinking about committees as a one of your oversight, one of your priorities. But today we're really going to be focused on the 889 waiver renewal and equity. And we'll be doing, just in the beginning, some context setting. We'll review some documents that you all saw at the pre-retreat sessions, which reflect some of your updates. Then we're going to hear a bit from Pat after that about OHA priorities and the intersection, and then 889 in the waiver. And obviously equity is central to all of this work, and we lifted it up yesterday, we'll be lifting it up again today, and we have a specified time to discuss it. And Leanne Johnson will be with us for that discussion, and she and Trilby will be leading us through some of that. And then finally, at the end of our time today, we have a chunk of time to talk about what about the other work, past priorities, what else is out there? I know that you all want to have that conversation. And the big difference between yesterday and today is yesterday there were a lot of presentations. Today we have a couple of short sort of information sharing from Pat, and then both on 889 and the waiver, but it really is structured to give you all a lot of structured time to talk together. So that's what the day looks like. Before we launch into sort of the level setting about the priorities, I want to see if folks have any reflections from yesterday they want to share, anything that particularly struck you, or any questions or comments about today. So let me just pause for a moment and see if folks have anything they'd like to share, reflect on, or sort of lift up for today's discussion. Okay. What we're going to do, what I want to do now is just, as I said, a little bit of the level setting, and reflect back to you a couple of things that you said in those pre-retreat sessions, which again were not public meetings. There was no quorum, and there were no decisions made at those meetings. But we did look at some documents, and then staff took them and revised them. So I just wanted, they're in your packet, I wanted to call your attention to them. The first was that policy making and oversight document. And one of the requests there was really to update that document with current, and this is in the, I think the board orientation packet. So this is in that packet, and you all wanted to just sort of lift up and make it more current. So that's what because the stuff that was in there in the past was a laundry list of things that the board had been involved in and engaged in the past. So this document, and I think in those sessions, you all really said we all get and agree with sort of that definition of policymaking and that definition of oversight. So nobody had any concerns or questions about that. And I do think it's a helpful document as we're talking about the work, is what is your role in these different subject areas. So just wanted to call your attention to that and see if there's any feedback or comments, anything folks wanted to add about that. David.
No, I just was pulling up the document. And
okay, good. You weren't on mute, so that was maybe you have something to say. Anybody else want to weigh in on this? I'll give people a moment to pull it up. We just want to be sure we captured your comments. Do folks feel good about the document as it is, as a guiding, just sort of document on policy making and oversight? Okay.
I do. I appreciate the frame, and I like that it's current.
Brenda, you got to speak up a little bit again. You got louder as the day went on, but
I know, right? Maybe because I got more animated. No, can you hear me now?
Yes, thank you.
I appreciate the frame. I appreciate the focus and that it's current with our top 3 priorities. I think the thing that I wonder about sometimes is as we think about our legislative interactions and responsibilities, does this document actually think about that broader context? And so, you know, I'm thinking about when when OHA is submitting a bill or a legislative concept, the way that we engage this board is often after the fact. You know, it's after things have been cultivated, you know, through OHA and lots of other work that's happening. So I was thinking about whether or not our inclusion happens earlier in the process, and it's just kind of a footnote. I have no objections to the document itself, just wanting to think about what that inclusion looks like.
Great, thank you. Okay. So noted, Brenda, that might be, especially as we talk about priorities and as things are developed around those priorities, at which point do they come to the board, I think is a worthwhile consideration. The other document which we reviewed yesterday is the framework of roles and the leader, collaborator, supporter, communicator. And again, we pulled it up yesterday, but it's in your packet for today. And we walked through it, but wanted to just sort of check in and see if there's any other comments on that.
I just want to emphasize, I think that's one of the most helpful documents we've had since we've been together the last few years in terms of defining roles. And I think it helps provide sort of focus and definition of how we contribute to a broad scope of work. So I think it's really very helpful.
Thank you, David.
I agree, David. I think also one thing we might want to keep in mind is when we are in the collaborator supporter roles, in particular, who we're collaborating with or who we're supporting. Sometimes that's not as visible to me. You know, if there's some other entity or body that's taking lead on a particular initiative, we're in the collaborator role, just being more explicit around who's leading.
Kind of to echo what Brenda was just saying about being really explicit, and this is, you know, maybe a little bit too much, but I was going to say, when we have our agendas, we may even want to color code, you know, like our documents connected to like, where are we in this? It would be a really easy, like visual, like, oh yes, reminder of what we're supposed to be doing in these efforts.
I saw Kirsten nodding, and that might, so that maybe staff can take that under advisement, that, or just to, color coding is a great idea, as well as just thinking about calling it out explicitly. I think that's the point. And I think one of the things, and you all mentioned this in the pre-retreat sessions, is there's going to be, sometimes it's not always going to be super clear that you might be in between leader and collaborator, or in between supporter and communicator. And so there is going to be a little gray there. But I think what I'm hearing from folks is just continuing to use this framework will be really useful. Anything else on these documents before we also, in your packet was also the decision-making document that everybody liked it. Instead of calling it sort of guidelines for decision-making, we had a really good suggestion to call it sort of principles and values or something that around your decision-making, because it was less a process and more sort of a philosophy. So we did make that change. So that was in your packet as well. What I want to do, any other comments before we sort of shift into the meat of the discussion? Those are some preliminary matters. Brenda.
Just a quick carryover from yesterday. Sorry, I didn't mention it earlier. It's around just an update on recruitment, or where we currently stand in filling out our board membership. That would be helpful grounding for me today.
That's great. So let's, I'll ask, I think Jeremy could speak to that. Jeremy, are you able to, I think I see you, are you able to just give us a quick update on recruitment?
Sure. So I don't have the numbers quite in front of me, Tara. There's stuff to kind of read some of that around, but we did do a kind of a broad call for applications, received quite a few. I would say didn't receive probably the diversity that we had hoped for, but had some great candidates in there, and still trying to work through how we can kind of bolster that. And then received a lot of applicants that are ineligible. I think, as folks know, we have a 4-seat cap on number of members who are either you can't have more than four members who either have income from healthcare or are on a state health plan. And we received a lot of folks from the industry or close to the industry. It's the way the statute's written is it actually excludes a lot of people who I think maybe we wouldn't actually normally think of as kind of coming from the industry, but they fit in there one way or another. They're doing a little bit of consulting here or there, work for a university, so they're likely on the state health plan, things of that nature. So we received a lot of folks that were ineligible. We're waiting to hear kind of what the governor's office is thinking about in terms of next steps for Senate confirmation. I think they're waiting for their timeline of when they submit names. And we've been out trying to round up a few more applications from folks who we thought would apply and didn't, or would add some more diversity. So that's where we're at right now. I think would welcome input from the board on I think as we go through today, as we've talked about, not on names necessarily, but I think as the board's thinking about its role over the next year or two, thinking about the types of the types of expertise that would be helpful, might be helpful for us as well.
Given that we cover 1 in 3 lives and 20% of the economy is healthcare, that eligible pool is shrinking.
Right.
Do folks have questions or comments for Jeremy?
Just, do you have a timeline, an expected timeline? That's one question. The second would be, do you anticipate bringing names to this group? I know that it's not our scope and responsibility, but if there's a process that you want our engagement more in a different way. Yeah.
Yeah. We received 18 applications. We were not planning to bring names to this group. As we've talked about, it's really the goal of the governor's call. I think what is really helpful is to be able to identify where you see as gaps of expertise or types of interest. And I think us be able to put that forward to the governor's office to say, this is the type of, these are the types of expertise or interests or backgrounds that would be really helpful. I think that's a good place for the board to play.
When would just to follow up, when would be the right time for the board to do that? Is that something that should happen today, separately?
Yeah, I mean, I think I suspect it'll come out as we're going through the day, and maybe we could spend a couple minutes just at the end of the day as a kind of some final thoughts. That would be helpful. In terms of timeline, so the way the process works is, in essence, the Senate sets the timeline. They decide when they're going to hear confirmation hearings for Senate confirmed positions. And then that sort of sets the timeline. The governor's office usually has to get names in roughly a month, 3 to 4 weeks before that. And last I heard, I think they're still waiting to hear when that Senate confirmation will be scheduled. Maybe it's been set and I don't recall, but I think the last email chain I saw, they're still kind of waiting for that to be set from the Senate. So that will drive when the governor's office will make appointments.
This is Tara. I was just going to add, it looks like the week of March 22nd to 26th, that's when they're looking to have the Senate confirmation hearing for new members.
So it'll be timely for us to get some feedback to the governor's office after the retreat today.
So I'll make sure we have some time at some point today, probably at the end of the day, or we'll see where else we might have a little extra time.
Yeah, thanks. And if we can also just be thinking about what that'll mean for liaison connections, as we recruit from this group, and then we think about all the conversations we had yesterday about committees and support. So I'm linking all those things together in my mind.
That's great, Brenda. Thank you. Okay, we're going to shift to this conversation about priorities. And so one of the things I just want to remind folks that what I've heard from all of you, both in interviews as well as those pre-retreat sessions, as well as some of the comments yesterday, is the board can't do everything. And you can't be involved in everything in a deep level. And there may be and one of the things you all said to me is we want to focus on those North Stars. We want to think about going deeper as opposed to broader, and bringing in some of those things that we know are super important right now, bringing those to the forefront and being responsive to the governor's request. And, you know, it's hard, I'm sure, to hear in some ways all that good work the committees are doing and think, oh, I want to do all of those things. And you do have an oversight role there. And so sort of finessing that oversight role along with this like leader, we're really focusing on these three issues and balancing that. So I hope folks will sort of keep that in mind as we talk today, is how do you really continue to focus on those North Stars, focus on equity, the waiver, and 889, and balance that with the other work you have as doing oversight of the committee. So Pat is actually going to do some context setting for us in terms of thinking the OHA's priorities and the board priorities. And then, as I mentioned, we'll go into conversations focused on the healthcare cost growth target, the waiver, and equity. So Pat, I'm going to turn it over to you to give us some more context on this.
Great, thanks, Diana. When I think about OHA's priorities and the board's priorities, what I think of are overlapping but not identical spheres. And that seems as it should be, right? We shouldn't have sets of priorities that are completely separate from each other. But the fact that there are some things that we're focused on that are a little different than what you're focused on, I think doesn't trouble me. And I'll talk through that, and I'd be interested in your feedback if you feel that's the same thing. If you look at our legislative package and our budget priorities, we really group them around the same things that are in your priorities: equity first and foremost, cost containment, value-based payment strategies, all the work that's around 889 and the work that's kind of close cousins to it. And then the place where there's a departure is a significant emphasis in behavioral health. Let me kind of take each of those pieces a little bit one at a time. Equity has been an increasingly loud through line in the work that we're doing, going clear back to, gosh, I guess it would have been the beginning of 2018, when we started implementing our performance management system, and started with the decision to take population health measures and disaggregate them as our top level measures rather than rolling them up into single statewide measures, so that we could make visible at the top line disparities in health outcomes. The idea being, if we weren't seeing it right in front of us all the time, then the nature of the roll-ups would allow us to kind of forget about those issues and not put emphasis on them. We've continued to build that emphasis through what I talked about a little bit yesterday in terms of your adoption of the health equity measure and our adoption of eliminating health inequity as a strategic goal for the organization. So really elevating without replacing health equity from a value, something we pay attention to while we do the job, to being the definition of what the job is. And we really are beginning to see in the organization with an encouraging degree of, I guess, what I'd call spontaneity, equity being a beginning consideration about various elements of work. It's uneven for sure. There's resistance within the organization for a variety of reasons, all the stuff you would expect to see. But really, that focus on equity as a strategic goal is beginning to take hold, and that now shows up in things like our budget requests. It ties into work that's been done through the pandemic. So significant investment in community-based organizations, I think, is something that you would not have seen, well, and you didn't see in budgets going back any number of cycles, and now it's something that's there as a critical component of what we do. Not just CBOs are important and we should think about them and talk to them, but that we actually need to invest in their capacity and provide them resources to do work that that they're uniquely well suited to be able to do, as an example. You'll also find in our budget and our bills the focus on the cluster of work around the waiver, 889, cost containment, all these issues of, it's all well and good to be transforming the system, but if prices keep going up at a rate faster than the rest of the economy, you're still crowding out all the other spending and still not delivering the triple aim ultimately. The places where there are disconnects from the board's priorities are two big ones. One is the COVID response. I think the important thing to bear in mind there is we have a lot of oversight on the COVID response. We've got legislative oversight, we've got strong governor's oversight. Lots of people are paying close attention to what we're doing and suggesting ways to improve that work, identifying blind spots for us, and those kinds of things. And I think at the end of the day, that oversight has been really effective. Just looking at the ultimate results, if I've said in a few settings, if you're an Oregonian, you're less likely to be sick, more likely to be alive, and more likely to be vaccinated than people who live in almost any other state in the country. And for some of those measures, it's by a long, long way. To be sure, there like everything else, there are disparities, there are equity problems, and those kinds of things. But even within those categories, the rates are such that you're mostly better off being here than elsewhere. And so I think the fact that that's not a strong oversight element for the board, or not a strong priority for the board, is okay because of the rest of the structure that's there. The one that's a little more challenging, but I think still is okay, is behavioral health, particularly given your strong focus on behavioral health up to this process. We came out of the last legislative session with some really major investments in behavioral health, went into the budget cuts session, having many of them rolled back or delayed. The governor's budget now reestablishes and includes more of those investments. And then, of course, there are some really, really big structural changes, Measure 110 being the primary one. And again, this is now an area that's got significant and robust oversight structures built into it. The 110 has got its own extensive advisory committee. The Alcohol, Drug, and Drug Policy Committee has been revitalized and has a new strategic plan. There's significant legislative oversight and interest in this work, including behavioral health committees legislatively. And so I think those are two big bodies of work that are going to continue to drive a lot of attention and investment in the health authority that are outside your priorities, but that have strong linkages back to your priorities, particularly in terms of equity, because we can't approach either of those without health equity, health inequities being a significant driver of that work, and do it successfully and do it differently and get better outcomes than the outcomes that we've gotten previously. So let me maybe stop and take a breath there and see if folks have got thoughts or reaction to those kind of overlapping spheres as we kind of conceive of them right now.
Yeah, Pat, that really helps me. I mean, to be honest, I think it would have helped along the way for you all to be clear, we got this, and we know you're hearing about it, but we got this. Again, when I read the letter from the Health Equity Committee back in September to us, they asked us to really become involved in equity issues around COVID-19. During the summer, we had sessions that I thought pretty powerfully showed really the terrible things that were happening in the Hispanic and Latinx communities, mostly in agricultural areas. And so, it was just hard to experience that. And I could kind of tell you got this. In fact, you were getting all kinds of oversight and input. But, I think the most important thing would be you must be learning incredible amounts from what is happening in COVID. And at some point, coming to us and sharing what you have learned. I mean, I support what the governor did related to teachers. And many of my senior friends are not very happy with me because I see it as actually a social determinant decision. You prioritized a really important social determinant, education. And that makes sense to me. But I, you know, to the degree as we move along in areas where we've been exposed to something, some other folks now have it. It would just be great to hear from our experience, here's what we learned, and you might want to keep this in mind in the things that you are doing. I hope that makes sense.
Yeah, no, that totally does. And I think of it in kind of two respects. I think, sadly, I don't think it's going to be 100 years before the next pandemic, just the nature of global climate change and zoonotic diseases and all that. So I think there are lessons that we can preserve for the next pandemic that we'll be able to call on. But I think also the learning has been, and this is learning for those of us who don't have the same day in and day out lived experience, who already know the impacts of the structural racism built into the system and the disparities that exist. But coming out of this understanding, what about the disparate impacts were in the response to the pandemic and what were already baked into the system that we need to unbake out of the system to get a more equitable health delivery, healthcare, health broadly delivery system, so that the systems and populations are more resilient to the next pandemic or the next health issue at a smaller scale that has those same impacts. I think those are both areas of lessons learned that we can certainly talk about.
Ebony, please, and then Kirsten.
Yeah, I appreciate, John, you highlighting that, just because I think in one of the board prep meetings, or I think at one point, I kind of also talked about how, you know, we are in this pandemic and Oregon Health Authority is like the lead agency, you know, from the state perspective, that's really leading and guiding the response. And so sometimes it feels as though like we're, you know, out here on a different planet, you know, in a sense, because we got this pandemic going on and we're over here focusing on that. And so, you know, I think that there's a lot of learning that we're discovering and experiencing and seeing prove true in terms of, you know, the scope of healthcare from behavioral health all the way to, you know, primary care. And so, you know, to me, it's, you know, what I'm also hoping and looking forward to is hearing about, you know, how some of that learning around some of the things that have proven effective, some of the things that we didn't know and realize were effective, you know, will continue to remain and be sustained as we move forward. And so, you know, sometimes I just, you know, have this level of anxiety. You can tell I'm a behavioral health person, I'm talking about anxiety of like, hey, there's a pandemic and this is all great too. And it's all interconnected because we will be in this for a period of time, especially as we think about kind of the various phases all the way through the end of the recovery phase, which is years out.
Yeah, no, I think that's really true. And one of the things I think of as an example coming out of that is our proposal for Cover All People, realizing that people's lack of access to coverage because of their immigration status, not so much because they needed coverage, but because they weren't connected to the healthcare system at all because of that lack of coverage is, I think, an example of the kind of thing that comes out of this and becomes a significant improvement to the system that I think over time, as we're able to grow it, can really address the underlying disparities.
Kirsten and then Jeremy.
I appreciate the comments and also just want to underscore that in thinking about the board's role in these different areas, thinking about the board as a communicator as it relates to some of these lessons learned. And so it'd be great for our knowledge for the like repeat back learning process for the organization and for the state, and then also how we're kind of using that communication platform to reassure others that like we're learning and these are our takeaways. So appreciate that. I did have a question about behavioral health, and Director Allen, I'd love to hear. I think I am happy to hear that it is a priority and a focus, even though it is not a priority of the board, because it is exceptionally important. And I understand why it's not a priority of the board at the moment. I would love to hear your thoughts on who, like, is OHA the leader in that space? And what role you do want how the board can be helpful in that work, even though we are clearly not the leader or maybe even collaborator.
Yeah, that's a really great question with, like everything else, it seems a reasonably complicated answer. I think the answer is there isn't a leader in that space, and that's part of the challenge. That space is terribly fragmented, and pieces of it are highly resistant to leadership. And so I think what we've probably learned is two things. One is, I may be inventing a phrase, I'm not sure, but strong convener maybe is kind of the right way to think of that work. But I also think about, we're in budget hearings right now, and I'm finding myself talking a lot about the reason OHA exists is to consolidate purchasing policy and regulation in the health space to leverage transformation. And I think the track that we were on that we will need to get back to in behavioral health is leveraging that purchasing. We pay a lot of money for behavioral health in Oregon. But the problem is it goes in two big directions and lots of other smaller directions. And there's not sort of a consolidated, where are we trying to go and where are we trying to get? And that was the work that Steve Allen was beginning to launch before the pandemic hit, and he needed to become our resident expert on long-term care facilities and COVID and things like that. But I think that's the important stuff we're going to need to come back to is big allocation of money that goes through CMHPs, big allocation of money that pays for behavioral health through CCOs, big direct payment that comes in fee for service, and those things have got to be stitched back together and use that purchasing to be able to drive more transformation in the system. But at the end of the day, I think it is some version of strong convening that probably helps get us there, rather than trying to identify or take a position as a leader. I'm happy to get pushback on that if others think I'm out in left field on that.
I just appreciate, the focus and the call out, the intentionality around behavioral health, because behavioral health is a critical and essential element of healthcare. And I know that I'm preaching to the choir, but what we also find is that, the disparities and the inequities play out, in the behavioral health realm as well. And again, the more that we can see improved outcomes in behavioral health, that impacts also kind of the broader health outcomes and targets. And so, I keep saying this, I just think that we just can't become so compartmentalized in our thinking. And again, I don't see that, and I just appreciate, the continued kind of perspective around the broader behavioral health, not just specific to Medicaid or CCO 2.0.
So I have Jeremy, Brenda, then David. Jeremy, please.
Yeah, I was just going to add, I think on the question around kind of lessons learned from COVID, I think there's a couple of big buckets there, as Pat was alluding to. There's the learning how to manage a pandemic and prepare for a pandemic. And then there's everything we've learned about things that are broken in the health system that this provided very concrete examples to. And I think we've got some really concrete examples of things that we had talked about during the CCO 2.0 process as we all know, but they were kind of conceptual, and we've seen some really, really specific examples. And so I think certainly we can weave those in as we think about the waiver and we think about coming back to those CCO 2.0 goals. So I just wanted to say that I think without the board needing to feel like it needs to lead in the COVID space or manage that whole body of work, I think there are ways we can certainly bring information that we've learned from kind of challenges within the health system that have really played out. secondly, on the behavioral health piece, I mean, I think one of the challenge, having seen many efforts to launch different versions of behavioral health task forces and collaboratives, and it's been a really tough nut to crack. And it's, I've seen folks dedicate years, or a year and a half long process repeatedly trying to pull folks together to lead in that space. And so it's just a very complicated space. But I do think that there are some, even if the board is not the leader of the behavioral health work, there are some connections. I mean, behavioral health was a part of a CCO 2.0 goal, and that you all set some policy direction there. That's important to move forward, and also the governor's budget includes a big investment in behavioral health workforce. You all are responsible for oversight of the workforce incentive program, and that would add more dollars. If that passes, that would add more dollars for behavioral health investments within that. So there are some concrete behavioral health pieces of work that I think are clearly under the board, even if the board isn't a leader on trying to solve the broader behavioral health challenge. And we had a good conversation with Steve Allen yesterday. He's happy to do educational sessions or webinars or whatever to kind of help keep you all, those of you who are interested, keep you all informed of kind of some of the broader behavioral health pieces that are moving as we move forward.
Go ahead, Brenda, and then David.
I really appreciate this conversation and the framing. And as I listen to you, Director Allen and Jeremy, think about the ways in which we can thread it across our committee structure. So as I made the connection you just made around the Medicaid Advisory Council, the 1115 waiver, ensuring behavioral health is represented there, instead of a centralized kind of function, to the point you've made about failed attempts at behavioral health collaboratives and things like that in the past. What I'm wondering about is our ability to actually do that across all of the initiatives that we have in front of us. So if we're thinking about kind of a sandwiched approach for, the cost growth target work with a behavioral health lens, or health equity in behavioral health, and thinking about ways in which we frame our objectives and our goals that also hold some tension to that, so that it doesn't become something that just, we have no visibility for at all. So I don't know if that made sense. I'm happy to explain further if it doesn't.
I think that if I can respond, I think that we can talk more about this when we get the cost growth target, but I really encourage us not to think about the cost growth target as only about setting a target and did we meet it in a given year. I mean, I think it really is about bringing together data and information to have more informed conversations around where are the challenges and opportunities. And some of those are better understanding where we're spending money, and are we spending money in the right places that we want to be spending. And that's tough right now because we think about all these systems in a fragmented way. It's like, well, how are we spending a Medicaid? How are we spending commercial? So I think to bring your point, I think it's very well, we're aligned with where we want to take the cost growth target work, which is, there will be a conversation whether we meet the target or not, but hopefully the rest of the conversation is actually about, but what is the data telling us about the challenges and opportunities, and what does that mean in terms of our priorities for 2023 or 2024, and that it becomes kind of a reoccurring way that we can keep thinking about how do we thread these things together, and where do we really need to lean in a given year.
David, go ahead.
I think I'm reinforcing what Jeremy and Brenda just said, in that I see a lot of continuity with behavioral health and our 3 priorities, because we can't do the 889 work or the waiver work or pay attention to health equity without asking the question, where does behavioral health fit in each of those? This group is going to ask that question over and over again. We're going to ask about social determinants of health. We're going to ask about health equity implications. And I think that is going to be, a really focused part of each of these discussions. And I see the work of our work we did during CCO 2.0 really continuing in each of these areas.
Thank you.
Yeah, just one tiny example that occurs to me. You can't talk about the waiver without talking about housing. And when you talk about housing in the context of the waiver, you're talking about not just housing as an overall determinant of health, but you're talking about housing for people with behavioral health needs and services that go with that housing, and all those kinds of things. And so you can't, as you say, David, there's not a topic you can't go through that doesn't have some kind of an implication into all these topics, but in particular in behavioral health.
And can I just, my last comments, specific to this is, is that I think it's important to understand kind of the recent history of behavioral health over the last 30 years. And so, that might be an interesting topic to bring forward in a webinar, to like really, there's a lot of kind of perspective. I'm not going to call it a narrative, but like, how do we really take time to understand over the last 30 years, here's kind of, what the priorities, the focus, the investments have been. Here have been kind of, the major time periods where we seen some significant impact, where, we've seen some downward trends, but, being able to also understand, where we've been from the behavioral health perspective, I think is important, just because also, and again, this might be a biased statement, but in my opinion, and I think oftentimes when it comes to just publicly funded services, it's a very precious resource. I'll be strength-based and say it's a very precious and limited resource. And while we know that there's a lot of dollars that go into behavioral health, there's a lot of dollars that flow into public health, so on and so forth, it's about how are we being most strategic so we can be most efficient, effective, and have the greatest gain. And we know that it costs money. And in my opinion, we need more. And so, and then, I just also, there's some keywords when I hear our system is broken, our system is fragmented. Now, there's always going to be gaps and challenges, but then my mind goes to, okay, so compared to other states, and based on what we put in to the behavioral health system as compared to others, is there an astronomical difference? Where is it that we're failing as compared to others when it comes to kind of, publicly funded services? So anyways, I'm just thinking out loud, but, those are my final thoughts around behavioral health. So.
Thank you, Ebony. Any other comments on behavioral health, John? And by the way, I mean, we also scheduled to have this conversation later, but Pat has to step out at the end of the day, so I want to be sure that we have him here for this discussion. So I think it's important that we spend time on this so that folks feel so we're on the same page moving forward. Go ahead, John.
Well, my comment isn't about behavioral health, so.
Okay, so let me see, Brenda, go ahead.
Yeah, it's a request and it speaks to the cost growth target, and it is about understanding data from a risk stratification standpoint for those that have significant and persistent mental illness or substance use disorders, and how that plays in the healthcare cost space. I've looked at some data in the CCO that showed that the rate, the total cost of care for that particular stratified subpopulation is significantly higher than the general population in Medicaid. How do we take that kind of an information broaden it from an actuarial standpoint to have cost and redistribution of resource in that particular, space or in that sphere? So I wanted to leave that point. And then before we think about kind of alignment of the board's work, just to riff off of your comment, Diana, around Pat, your presence while we're here, I've been thinking about how the agency's strategic plan, how you're helping us have visibility into the work that you're doing over there to see where these crosswalks are really important for us to continue to pay attention. So while we have our 3 governor priorities, we're talking about behavioral health and COVID and the intersectionality from the health equity standpoint. I'm thinking about the other things that the agency is doing and where you want us, and maybe I'm not seeing that, or ways in which we, the board, can inform ourselves about some of that other work.
Yeah, I think that's a great opportunity. Honestly, we've been working to restart the strategic planning work, and getting traction while we're still in the pandemic is proving to be just so incredibly hard. We're doing some good work, but in terms of things that you would expect to see in a strategic plan for us to share with you, we're a little bit of ways away from, but I think it's a great opportunity when we are ready at that point.
Any other comments? And Brenda, the comment about cost growth target, let's make sure we lift that up when we move to that discussion. Let me see if there's anything else on behavioral health. I mean, we'll probably touch base on this at the end of the day when we talk about other work. But I want to be sure, well, if there's any, because we've spent some time here, any other final comments or questions? Okay. John, I want to hear your comments, see if there's anything else before we move into a specific conversation on the cost growth target, but go ahead.
Yeah, thanks. Yeah, just as I listen to Pat and Jeremy, you know, I'm just so impressed at the tectonic shifts that you all have been part of. And again, the lessons learned. I mean, an example. So I've been in Kaiser for 5 years. I have many senior colleagues in Kaiser. Kaiser takes care of you. They are always there. They are an incredible delivery system. They're always there until now. I can't get vaccinated at Kaiser. And now I think I know why. I think I know that in Portland, Kaiser and the other systems agreed we should do this together in a collaborative way. But the emotions on all sides as a result of that, you know, patients saying, this is kind of unusual that my doctor can't vaccinate me. That in fact, when I call my doctor, they say, don't call me. Stop calling me. You know, you just have to, you know, line up and figure this out. And, you know, I talked to a wonderful a doctor at OHSU who said, it's very unusual to be practicing, and here is one of the most important things in recent history that will help patients, and I can't get it for my patients. And I think I know why this all happened, and you all have done the right thing. But, you know, just the lessons you have learned are really important. And just at some point, I think we would all benefit, you know, because we really have left a medical model for a public health model for good reasons. And it would just be good to learn from that.
Thanks, John. David, go ahead.
Thank you, John. I was, you know, yesterday I was, you know, having fun with John, going from the medical model to the public health model, and, you know, ready to take on living wage, food deserts, affordable housing, you know, all the systems created by white supremacy to create health inequity. And then afterwards, I read the 889 document, which was an amazing prep document, and it was really granular. And then I realized, you know, with that enthusiasm, the 889 work all by itself is as big as all the CCO work we did together. I assume the Medicaid waiver is as big as that. And obviously the Health Equity Action Plan will be as big and complicated as all that. And so I guess the question for the rest of the day, maybe for Pat, is how do we will never get as granular as we did with CCO 2.0 on any of these issues if we're doing all three. And I would welcome guidance from Pat and Jeremy and the collective wisdom of the group as to sort of how do we balance these really complicated issues. And, you know, the 889 document, you know, talks about the statistical criteria for, you know, whether someone's meeting the cost target or not. You know, really, really important, interesting stuff. But obviously, we won't be able to deal that with the same level of granularity that we did with CCO 2.0.
Well, let me take a crack at this, and I'm trying to be cognizant of the fact that the governor asked you to pay attention to all three. But your observation is correct. You know, when we were doing CCO 2.0, that was kind of the singular focus that had elements within it. If I were in your shoes, I would probably err on the side of engagement on the waiver, because the waiver the waiver is the arena where the board can do the thing that I think the board can uniquely do, which is broad engagement across various stakeholder groups, publics, provide a platform for broad understanding. I think by the time we got to the end of your process, everybody knew what CCO 2.0 was about. Everybody knew what the objectives were. You knew what we were going to try to do in implementing that. Thinking about the discussions we had about CCO contracts and accountability and those kinds of things, for example. I think the waiver gives you a similar kind of a platform that, as we just talked about, does touch on these other things. You can't talk about the waiver without talking about equity, without talking about behavioral health, without talking about these other topics. But that's maybe different than the other pieces of the governor's focus. So I'm not by any means suggesting don't pay attention to all three, but that if you have a spare minute and you have to decide where to spend the minute, I would probably spend it on the waiver. Jeremy, I'd be interested in your perspective on that.
Yeah, I mean, I think, and we'll talk about this a little bit later today. I mean, I think so I guess a couple of thoughts. One, I don't think any of these are at this stage are as granular as CCO 2.0 or need to be as granular as that. I mean, we were literally getting into all of the different changes in contracts that were going to be part of the procurement, and the waiver is not going to have that level of scope. We just don't know, go ask the federal government for 60 things. It's just not possible. And so we're really looking for those big things that are important that really help move the model forward. And I think we've talked about in some of the prep meetings, one of the challenges that we're going to have in helping staff you all on this is just trying to weave together some legislative interest in this, stakeholder interest in this, the policy board. So bear with us a bit on that. But I think, you are really up to speed on CCO 2.0, and I think that the role is making sure that waiver really is pointed in the same direction of moving that model forward. I think 889 has got a lot of complexity to it, but we'll talk about this. I think it's a good segue as we get into the roles and responsibilities, because I don't think you need to feel like you need to manage every bit and piece of that program. I think it's about, frankly, I think the whole reason the policy board was created by the legislature was to keep our eye on the kind of big picture. Healthcare costs too much. The quality is not as good as it should be, and we need a body that's got that big focus. We got lots of folks that are in the weeds on stuff. All of your committees, and I think it's finding the right space in 889 that drives the big strategic conversation of, are we getting our arms around costs? Are we getting our arms around moving to value? And I think there's some concrete places that you can do that through the annual report and the public hearing, and you'll get it. I think our goal is you'll get into an annual cycle. It's not like a one-time body of work. So I think there are ways that we can find the right level on both of those. But I do also think that's why we've been so concerned about making sure that we really get clear with you all through this retreat on our priorities, because 4 hours a month fills up pretty quick.
I apologize. I'm gonna have to step off at 10 o'clock, but I'll be back on about 10:30.
Go ahead, Oscar, do you want to make a quick comment?
Yeah, and I understand if Director Allen has to go, but I had a comment and a question for him as well, but I'm sure we can get it to him later. I think this has been a really great conversation, and I'm kind of going back to how the conversation opened up with Dr. Santa's comment about the letter from the Health Equity Committee, because I actually read that letter again this morning, because I was like, I want to ground myself again to that, because I remember Dr. Santa mentioning it yesterday. And it was interesting because I read the letter and I was like, not surprised to read anything there. All of those things have happened in the past. They're currently happening. And if we don't do anything about it, different, they will continue happening even beyond this pandemic. So this kind of goes back to, we're talking about priorities, short-term priorities, the next couple of years. Here's the things. And then there's also this like strategic plan that by 2030, our goal is to end health inequities, right? And between like, I think it's between 2023 and 2030, there's a big question mark of like, we're not quite sure what we're gonna do just then. And we're also talking about the importance of behavioral health. We're talking about the, you know, sort of like limited resources. We're talking about like, how do we get more resources, and are very strategic and intentional about how we allocate those resources. So I'm curious, Director Allen, what your thoughts are in terms of how we can support setting a vision for the 2030 strategic plan. You know, I don't want us to get ahead of the agency's like staff and leadership in terms of kind of creating the structure that you need, but at the same time, how can the board be thinking about, you know, 2030 and kind of helping shape that so that we can become more comfortable with sort of saying, okay, for now, we're only going to do these 3 things, but please know that these are also really important over the next, you know, future years.
Yeah, that's a great question. And just thinking of it off the cuff without a little bit of time to reflect, I think the very most important part of the health equity definition is the statement about allocation and reallocation of power and resources. You know, and we've been using that language for going on a year and a half now, and you go into a room full of polite people and you say that and they all nod and smile until you actually sit down to try to make a decision that reallocates power and resources away from somebody and to somebody or something else. And even in the midst of a pandemic, and I'm old enough to know better, and I don't usually think of myself as naive or idealistic, I have been shocked at how incredibly difficult that has proved to actually be to do. The headwinds, the entrenched interests, the people whose normal reaction of who do they think to talk to see if they like or don't like the decision, it is unbelievably hard to actually implement change. When coronavirus resources were coming out of Congress and the legislature earlier in the pandemic, there were sectors where kind of money just rained on them. And I remember the months that it took us to get the investment in racial disparities and equity to help CBOs make investments to support effective quarantine and isolation. It took months and months to be able to get those resources allocated, and just seeing that difference play out over the course of the summer was pretty challenging. So that's a relatively long-winded way of saying I think you're having our back as we try to make those changes and face down some of those entrenched interests. I think is a role we should think and talk more about. That's been, I think, one of the, when I think about trying to get to 2030 and think about those allocations and reallocations, I think it's the most important work to do, and it's clearly going to be some of the hardest. Hope that's helpful.
Thanks, Pat. And I know you have to jump off in a moment. Okay. This has been a really, I think, helpful framing conversation, and in terms of thinking about all this work and how you focus. And, you know, I know that there's been this big conversation that we've had with you all about behavioral health and where does that live. And I hope that Director Allen, some of those, his words and some of that conversation helped with that. We'll circle back at the end of the day, but hopefully that, you know, when we talk about where's this going or where's that going, when we're focused on this, that some of his sort of reflections help that. As we continue to really talk about those priority areas, we want to move to this very specific conversation, although as we've just heard, it's not, cost growth target isn't just this thing over here, it's all the things in many ways, right? And that it's not just about cost, it's about quality, and it's about the system, and it's about, you know, so many of this conversation we've had yesterday and today sort of pulls through this discussion. So what we want to do is talk a little bit about, I think Jeremy's going to walk us through this proposal, because when we, folks, I think what we heard, and I think this is right, is, well, what does that work look like, right? If we're focused on cost growth target, what does that look like? And so we have a proposal for what that could look like that was in your packet, and Jeremy, I think, will just walk you through that again. And then I think then the conversation we want to have with you is, does that resonate? What's missing? What are your questions? What is, to really try to get some clarity here. What are the important considerations you want attached to that? And then we'll also just want to touch base on how can the health authority support you in digesting some of this really technical stuff. But let me turn it over to Jeremy, who'll sort of walk through this proposal.
Great, thanks. I think we've got a couple slides, right? Perfect. Great. Thanks, Michelle. So you guys are obviously familiar with this, but just as we've walked through or tried to map out kind of the major bodies of work, as you've seen in the materials, we tried to link them up with, and this is obviously up for discussion, but kind of at least try to have something for you to react to. Do we think the body of work is a role for you as leader, collaborator, supporter, communicator? I will say, these are obviously, we've talked about a little fuzzy, I think, being responsible for the work versus actively an active role in developing it as a collaborator. To me, that is still a pretty leadership role. It's just not being 100%, there are other partners in doing it. So just keep that in mind as we go into this. Next slide. So I'll walk through kind of the major buckets of work that we see in 2021 and 2022. First submitting the implementation committee recommendations, which you all did in January, which was a big accomplishment. I should actually say before I get into this, I think we want to walk through the proposal, but then want to spend most of the time on discussion and questions. So want to know what your questions are around this. What are your thoughts and reactions? Does this resonate? And really, it's hopefully getting some conversation around going forward. How do we really support you all this year as we go into launching this work? Back to the slide. So have submitted the recommendations. That was clearly a leadership role for you all. You were tasked with actually, we needed to actually approve those and submit those. The next piece, and we kind of did these by role as opposed to sequential order. So you can see in the middle that they're a little out of order from calendar perspective, but we thought it'd be easier to organize it by role. See a role this year is really developing the charter that will replace the current implementation committee. The current implementation committee by statute goes through the end of the year, but there's been, the committee recommended that there be an ongoing committee that lives on. We talked a little bit about this yesterday around, we really see multiple purposes of that, and providing kind of ongoing guidance to the program broadly, but also as an advisory group to the board on what's happening with costs and information around what the data is saying, as well as helping us understand where, I think to Brenda's point earlier around, there are a million things we could be doing deep dives on with data every year, and we'll need to hone that in on a couple of things that we think are most important and help really inform both the state and policymakers and the health system in terms of where there's challenges and opportunities. So we see that as a critical role of the committee, and so we really see you as a leader in developing that charter and giving us direction in terms of recruitment. There's a body of work that will exist around planning and monitoring for unintended consequences. Obviously, we do not want to see costs come at the expense of quality or exacerbating inequities. We know there are more than enough opportunities out there to actually contain costs in a way that improves quality and outcomes. And so that's the area we want to be focused on, not things that could actually detriment that. So we'll need to come up with a framework for measuring that. The implementation committee recommended pulling in the health equity committee and the health and quality metrics committee, so two other board committees, so a big role on helping collaborate across those committees, and so really see this as a collaborator role, to really see the board helping set the overall priorities for monitoring. I should also know that there are some connections here beyond 889. We think we need to be doing creating a similar type of framework for value-based payment. We expect that in the waiver, we're going to be really pushing further and further through global budgets, and there will also be a need there to kind of protect unintended consequences. So I think there's a role here, not just collaborating across committees, but also making sure that we're creating kind of maybe a common framework for protecting against unintended consequences. Also need to come up with a plan for quality measurement generally, not just unintended consequences, but making sure we're actually measuring quality. Again, the recommendation from the committee was that the Health Plan Quality Metrics Committee help with that, and so see this as a collaborator role. There'll be the need for developing what the process and template looks like for performance improvement plans. These won't kick in until 2023, but there's a need for kind of what is all in that performance improvement plan, and what's the process look like. And so see this as a supporter role and helping provide guidance as we're trying to develop what those templates would look like. There's a huge role here around transparency and publishing reports on what's happening with costs. We see this as a huge communicator role for the board, and I think Brenda, this gets to some of your point of not just kind of what's happening in the broad picture, but what are kind of deep dives that we could be doing. And I think it's not called out on here, but we had sort of envisioned there would be some type of soft launch of the first public hearing this year. It won't be necessarily around are we meeting the target or not, because that data won't come till 2022. But I think there's an opportunity here that the board could play in that kind of communicator role of not just having data that we put out there, but also starting to convene stakeholders and getting us kind of ready for that public hearing space of what is the data that we have right now telling us about what's going on with costs.
Jeremy, can I jump in for 1 second here? Just a question about, because this has come up, and in terms of collaborating, I think it would be helpful, who is the board collaborating with? So just because that's come up before, having some of that clarity would be great if you have it.
Yeah, absolutely. And I think Sarah's on, so Sarah, please feel free to jump in here. And this is where I think, the word collaborator is kind of a misnomer in my mind, because I think this is kind of a leader collaborator type role, especially around, if I lost my slides here.
I can jump in. I think one of the pieces of collaboration is with the committees of the board. So the Health Plan Quality Metrics Committee, the Health Equity Committee, the 889 Implementation Committee. There's collaboration across and in between the board at that level. There's also collaboration with OHA and with DCBS, who are working on implementation of the program. So there'll be some technical details that need to kick back to the agencies and back and forth. And then there's collaboration with the stakeholders as we're thinking about what's important to stakeholders, both industry and consumer perspectives. I think there's a role for the board in helping communicate some of those perspectives and bring it all together into a cohesive whole, into that framework.
And I would say generally, I think on the supporter role, similar. I think it's supporting us and helping us make sure that we're creating a performance improvement plan that makes sense. That we've got to do that, and ultimately, the agency will be accountable for holding folks accountable, and part of that's a performance improvement plan. But I think we need support in terms of making sure that performance improvement plan process makes sense, is aligned with our overall goals of where we're trying to go in terms of transformation. I think similarly, communicator, I think that's helping us, frankly, have a louder voice and be able to really use, I think, what the board has, which is, an ability to communicate out and be able to get more attention on issues and be able to say, this is the type of data or information that's the most important to be paying attention to. So I think I think all of these are sort of variations of a partnership role with the agency. I don't know if that helps, Diana.
No, I think that's great. I think that's really helpful.
There's a few areas in here that we, I think would see as ongoing, but not see the board probably deep into, and that's, we've actually got to do rulemaking this year for some of the technical issues. We're going to have some technical advisory groups that will come up with things like specs for data submission. We'll need to go through body of work around collecting and validating data. We expect to work really closely with the implementation committee as that work's happening, but sort of see that as probably farther in the weeds than the board's role. And again, trying to find those places where the board's keeping its eye kind of on the big picture. Next slide. As we go into 2022, this is a bit of a more condensed version because we'll get into kind of more of a more regular rhythm. So launching the successor committee, again, see that as a leader role, developing and holding the first annual public hearing. I think we could kind of teeter between leader and collaborator in this. I mean, I think we definitely see the board as the convener of the public hearing, but also see them doing it in collaboration with other partners, thinking about who other key I think obviously as an agency, we'll need to be actually doing the managing the work to get to the point of launching a public hearing. And also, if you hold to the Massachusetts model, it's broader than just OHA. We think about, key legislators, DCPS, others that we might want to include in that process. So I think it's, kind of a mix here between kind of leading and collaborating with others to get that off the ground. Developing and publishing the first, and then after that, regular annual reports. I think again the board has a huge communicator role here. The whole point of this this annual report is to really be able to communicate to the legislature, to the media, to the public around what we know is happening with costs and quality and challenges and opportunities, and see this as a really key kind of communication function of the board. Again, there'll be an ongoing kind of data collection stuff that's in the weeds that we would see probably more at the implementation committee level and technical advisory committee level. What's not on here is accountability, and that's really because that doesn't kick in until future years. So 2023, we start with performance improvement plans. The escalated financial penalty wouldn't be until 2026. So we didn't put that on here because there isn't a role in 2022, but I would say that's probably more in the communicator role. But again, we don't need to decide that right this second. So I think that's kind of our overall, proposal. I think, again, obviously totally open for discussion, but we'll turn it back over to you, Diana.
Thank you, Jeremy. So let me just see, as Jeremy and I both framed up, sort of the questions for all of you, and what are your questions, comments, thoughts, reactions? Does it resonate? Does it feel right? Is anything missing? So let's start there. Any questions for clarification, or your comments about, yeah, this feels like the right work, or this is what's missing, or who's going to do this? So let me just open it up for discussion, because what we want to walk away with at the end of the time talking about this, as well as the other work, is that you all feel that you at least have some general, that there's some shared understanding of this is what our work looks like, and this is how we're going to be contributing as this is one of our focus areas. So let me just open it up for questions and comments. Brenda, please.
For sure, just affirming the purpose of the work and the framing is really critical for the board. So I think you asked that question, I would absolutely say I'm all in. I think the question that's up for me is, unlike some of the other activity, this feels like it's got such a long time horizon that while we're looking at it just with what's the work of 2021 and 22, we can think about how the for lack of a better descriptor, like the heat will start to emerge and it'll become more critical as we move forward. So what are our really critical intersection points as a board, that actually has us gearing for those more challenging topics and the times at which we have windows of engagement that's going to look a little bit different than it might be in its early kind of more nascent stages. So yeah, just reflecting. It's kind of leading me to this question about agenda setting for the board. What does it look like to put us on a calendar, on a multi-year calendar, just with intentions, knowing that may change over time, but we know there are going to be some intersections that are going to be really critical for our attention at certain parts in the continuum.
Let me see.
And can I just add one thing? I know you probably want me to not talk and let the board.
No, I actually wanted you to talk. Or
So
you were
I think this is something that's really, I think it's something that's been on our mind for a long time, is how do we build and create momentum for this and keep people engaged? And part of that is just, making sure we don't lose sight of this, because there is a ramp up. I think also, if there aren't some early wins in the early years, I think there's gonna be frustration by the legislature and others to go do other things. So I think there's that. And I think, and I think the piece of it is just making sure that folks know this is happening and are taking it seriously. So I think all of that is in, whatever role we'll call that. I think that's part of the reason that we felt like this year is really big, because we are a bit in this. We've created a plan for how we're going to launch this. We've got to implement it, but we know that the data we get a little ways out, and how do we really maintain momentum moving forward, and make sure that we don't lose momentum and lose the opportunity to use this program to build some of our broader goals. So I don't know if that's where you're going, Brenda, but I think that's certainly on our mind, and I think something that we'd see as a really critical role to partner with you on this year.
Yeah, I'll just follow up. I think, yes, that's where I'm going. And I also think that this is like one of those dark horses where it's a little bit of a sneaky, like emerging conversation. And I think when we talked earlier about redistribution of resource and power, this is a place where we should really anchor that attention. When we make that first move, we should expect resistance. We should expect it in a really big way, and we should be preparing for that resistance now. Right. And as we lay track, each one of those kind of moral imperatives, like the data that informs this work, the reason that we can stand on this, pulpit and have this conversation is really, I think, an important role and responsibility of this board, actually, to keep that guiding pressure, in some way, shape, or form. And so I'm mostly thinking about what is the cadence of turning up that heat. The first time we actually have a big move to redistribute resource, that's actually a really critical juncture in its success or failure. So how do we build to that moment? That's what I'm thinking about. Thanks, Jeremy.
Go ahead, Kirsten.
I couldn't underscore the point Brenda made more. I very, very much agree with that, especially for being thoughtful and preparing for that. So thank you for stating it so eloquently. I wanted to put a marker that part of what I find exciting, and I don't know if this is part of the vision for this work, but I will say that this is part of how I see it, is that when I think about those annual hearings and kind of the platform or stage that we as a board will create in convening those annual hearings, is not only about compliance with the target, but I think it's calling forward the drivers of cost or savings, and what's working and what's not working, and giving space to really kind of figure out how we replicate or how we address the problems. And so I see this stage as an annual opportunity, I guess, to make an assessment of what is driving price in our state in a good or bad way, and then using that moment to inform okay, so what should be on the legislative priority of the board, and letting that kind of evolve. So I'm excited for this work, and I think there's a lot of opportunity, and we should prepare ourselves.
And can I just double down on what Kirsten said, because I think we've been learning over the last couple of weeks where the New England states that are about at least a year ahead of us are, and that is that opportunity creation and thinking about the legislative agenda or the policy opportunities is exactly where they're at.
At the risk of Sarah throwing something at me virtually, I think we will, this may not happen exactly in the calendar year 2021, but we will be getting an initial round of data from 2018 to 2020 that will give us a baseline of what was happening during COVID. And we've also been running a whole bunch of other data and information that we'd like to get in front of you. And I think maybe it's not concrete in here, but I guess we had been kind of inherently thinking it. Maybe it should be more explicit that we do see a role of this year being kind of like getting the board, and I think there's a big opportunity to pull that information together and kind of have an initial, here's where we are, even starting as a state, going into this program. What do we know is happening with cost and quality, and so I think that could be a good thing to kind of think about building towards throughout the year, if that makes sense.
So I just, I'm new. So I just want to say that what I've heard is that, we are at a critical and crucial juncture. And it's, we are at that point where it's make or break. And it's an exciting opportunity. And we have to be very thoughtful, intentional, and strategic. Just again, so I'm paraphrasing. And so here we go. I also, in the spirit and commitment around equity and being mindful and leveraging teachable moments and demonstrating our commitment, and maybe I heard wrong, but I think, Brenda, you started out your perspective or your statement with, I don't know if it was dark horse or dark something. And I just want to highlight, and maybe I heard wrong, is that a lot of times when we reference dark, it's always negative. And so as a dark-skinned African-American, this is just a teachable moment. I've always committed to kind of saying things in the moment. Dark is always referenced as negative. I'm a dark African-American. And so when someone says, oh, dark or black hole or this or that, it automatically, triggers me in a sense. And so I just have always tried to, even in my own articulation and in analogies, just be mindful of that because there's dark humans and we're not negative. So anyways, just wanted to bring that forward. And yeah. I appreciate y'all, letting me take us down a bunny trail for a minute.
Ebony, I thank you so much for that feedback and for giving voice to that comment. It's really important feedback and I take it to heart, so thank you. Yeah.
Thank you. John.
Yeah, I think that this is just really important, and what Brenda and Kirsten have said is important. I found it really important that when Pat mentioned 889, he used the word price. When Kirsten made her comments, she used the word price. This is about prices. And Kirsten, correct me if I'm wrong, but I think the lead up to this came out of concerns from many advocacy groups that prices weren't transparent. And a variety of different ideas to do that, which were not acceptable. And, to Jeremy and OHA's credit, they have found a path to do this. But this is about price. And if you're worried about, are you on the right side? This is about what is supposed to be a market-based solution that is not transparent when it comes to price. And any economist would tell you that you cannot have a fair market without the consumer knowing what the prices are. I really appreciated Jeremy's comment earlier that don't think of this as just a 3.4%. Did it 3.4% happen or not happen? Because there is so much more, it's whether it's 3.4% or more or less. I think there's a lot of folks who are going to say, what's the price component here? what's the utilization? If it's 3%, has that happened because services have been decreased and not low value services, but high value? And actually prices have continued to rise? The price piece, I'm just happy to hear a discussion where folks aren't afraid to use the term prices. Thank you.
Brenda.
I wonder, Jeremy, and around the momentum conversation you were talking about, I was thinking about what a great opportunity this is for the ability, and I think where you were, John, around transparency for 2021. So are there, in the analytics space, Sarah, that you're working with, are there things that you think are going to be really emerging this year, much like the low value report, and sort of as the industry responds to these things, that if we take advantage of this opportunity that's in front of us, they're going to really elevate different kinds of conversations we should be thoughtful about. So
yeah,
not sure. Yeah.
Yeah, thanks, Brenda. So we've been working, so one of the things we've been doing, and just kudos to Sarah and Zachary Goldman and Steve Ranzoni and a whole bunch of folks who have been scrambling this last year, because literally what I have been doing for 2 years is grabbing national reports and throwing at them and saying, can we do this? Can we do this? And they've been doing an incredible job. And there are a lot of national reports that come out that talk about differences of price, utilization, where do you spend by service category. But we do that. We've done that in buckets. We do a little bit of that we do that sort of in development of CCO rates. And we do that a little bit in, DCBS can see some of it as they're doing rate review, but we haven't really taken our own data and done that in a more holistic space. And so we're really using the all-payer claims database in a way we haven't before to get some baseline understanding of that. So we've got two really significant reports that are going to be coming out that I think are really significant it can be a really significant opportunity for the board to really understand what the current state looks like. And I also think represents something that I've never seen a state do. So one is we're basically recreating, there's a organization called the Healthcare Cost Institute that has a bunch of national insurers, and they put out an annual report of what's happening with price and utilization nationally. Our problem is that the data for Oregon is always kind of a small subset of data. So we were recreating that actual same report in partnership with them using our all-payer claims database. And so that'll give us a much better view of what's actually happening. I don't think any state has ever used their all-payer claims database to replicate that same report. We're also doing a similar thing with RAND, I think, as folks know, has put out hospital pricing reports the last several years, and we're doing something similar here. Again, our concern has been that when they put that out for Oregon, it's a very subset of data, and so we're just trying to get understanding of, when we look at our all-payer claims database, how close is it or different from some of these national reports of how Oregon stacks up. So I think those are going to be some good opportunities for us to just get some basic understanding, and I also think is a good opportunity, frankly, for the board to add some voice and add some attention to those reports and information, because I think it's exactly the reason why we created the all-payer claims database, and I think it's exciting that we're getting to that point of being able to put out some broader information about what's happening. So those are a couple examples of things we've got in the works, but I think there's more opportunities. The thing I just would kind of bring back to is, I keep thinking about this redistribution of resources piece, and I think the first step in this is like sort of, it's probably a bad phrase to use for healthcare, but kind of stopping the bleeding. We can't even get there if we're growing at 6, 7, 8% for healthcare. We can't even talk about the investments that we need in housing or in education or other places. So to me, this really does, this isn't about the policy board investing in housing. I think this is about the policy board and OHA figuring out how we support the state to be able to make those shifts and investments to other places. And so I just want to, when I talk about kind of the big picture, to me, I think that's kind of the ball that we need to keep our eyes on.
David, please.
Jeremy, I just wanted to call out whoever wrote the legislative report, because I find that's really helpful. I think the webinars have been helpful. Our discussions have been helpful in terms of understanding what 889 is about. But reading the legislative report gave me a lot of reassurance that these are the pieces of the airplane. People have thought about how this comes together and how it works. And it's really helpful for the board, at least for me, to focus on these discussions that Brenda raises about and Kirsten raises about power sharing and health equity. And you talk about, stopping the bleed, controlling costs, so we can the state can invest in other things. That type of granularity and roadmap for us, or at least for me, was extremely helpful and helps, I think, elevate the conversation. And, as we get into the Medicaid waiver, similar type of material, I think helps us manage the workload and also keep the conversation at a high level. So whoever wrote that, thank you. I'm sure it's a team of people, but they did a great job.
It's primarily Sarah, and she's a rock star. And
yeah,
we're
good job,
very
Sarah,
grateful for all her nights and weekends working.
Let me see if there, John, let me just add, I just want to be sure that, if there are additional comments or questions on this work, and then we'll move on to waiver. But go ahead, John, please.
Yeah, just a quick note. In my entire career, the most common concern, criticism I've heard from physicians is, we don't know the price of anything. Now they're fibbing when they're talking about their own services. They do know what the price of their own services are, and they do know what makes them money and what doesn't. But they don't know the price of anything for the most part outside of what they do. And to the degree that this informs them, I mean, we were talking about primary care yesterday. To the degree that primary care can get some sense of what are the prices, it will be a revolution. It just doesn't happen. They just don't have it.
Anything else on this? Do folks feel like, the board members, do you feel like you have some clarity on what this work would look like? I think that there's some comments today that I think the staff will take and sort of, whether it's putting things on a calendar or really what are those concrete products that based on this feedback. But I don't want to leave the discussion, and if folks still have questions like, I want to be sure that you all have this broad sense of what this work looks like and it feels right. So Brenda, go ahead.
I do. I have a lingering question from yesterday, and I think John just spoke to it too, around the patient-centered primary care home, or that work group, that particular subcommittee, and its intersection with this. So as we think about value-based payment and the evolution of that, how it becomes a lever to pull. So I don't know if that's a specific, if it's a one-off, or how Jeremy, you and others are thinking about integration of that body. It's such a critical element, of making all this happen.
Yeah, thanks, Brenda. Actually, I'm glad you brought that up. I may not, correct me if I don't, please let me know if I don't quite get to your question, but I did want to come back to something that I think came up yesterday. I apologize, I wasn't on the call when it came up around primary care providers. And I think John, I heard a summary, kind of Jack referencing the primary care providers being sort of the foot soldiers in this work. And I think, so I want to be really clear. So this is not about individual clinicians or targeting the prices or accountability at the clinician level. This is really around measuring at the insurer level, measuring at the kind of provider organization level. We'll be, as we've talked about before, we'll be measuring total cost of care based off of tracking all the claims for a patient and it'll be attached to patients who had a primary care provider. That's the way we kind of like anchor the total cost of care. But it's not about naming, a certain clinician and saying it is about sort of naming organizations, at the clinic level or health system level, but not at the individual level. I think what Jack, I wasn't part of that conversation, but I think what Jack was probably referring to is that ultimately, to get our arms around total cost of care, primary care is kind of a big anchor there, because they're the ones who can help direct care to high value, higher value providers. I think, John, that's kind of where you're going with, if kind of they knew where the prices were. I think, Brenda, to your point around the patient-centered primary care home, we've seen where we've got folks in, you know, highly coordinated primary care. We've seen lower hospital costs and other things. So I don't, this is not about holding primary care accountable. What this is about, though, is I think continuing to advance that model of the primary care home and, you know, moving to value-based payment and things that get the health system working together to contain costs, and primary care is a huge anchor in that. So I do think that I think we're starting to see and believe we actually might be even better positioned than Massachusetts in this, because we have so many patients already assigned to a primary care provider. And so I think we actually, cross our fingers as we're kind of running up some of the data, we actually might be a better position to have a better read on the total cost of care for more patients statewide, because of the primary care home model, because we've assigned so many patients to primary care homes. So more to come there, but that might be actually one positive thing of all the work we've done in primary care over the last 10 years, is we just have we have more patients attached to primary care providers, and then can actually see total cost of care for those patients. But we've still got some more work to do there. So, but I do think it's a good question over time of where does the primary care home model go? And, you know, we've made huge advancements, and, you know, I think there's a lot of lessons there, probably longer conversations of, you know, in light of COVID, again, where we keep taking that model to. But I think we're well positioned for this work because of the patient-centered primary care home program.
Trilby.
Thanks. And Jeremy, I think there may be part of what Brenda's asking about that we got into a bit yesterday, and thinking about how some of the work connects across the primary care, the patient-centered primary care collaborative, and the focus on VBP in that arena, and then the VBP compact and the progress that's been made through 889, and the way that we're starting to connect as staff, thinking about Sarah and Chris, you know, really updating each other on these concepts and working together, and how we could potentially be using the committee structures to cross-pollinate and have conversation as well. So that might be something worth getting into. Maybe that's a longer conversation for later, but I just wanted to flag that as a really important connection as well.
Okay. Brenda, did you get your question answered?
Yes, thank you.
Anything else as we tie this piece up? Folks feel, let me ask it this way. Does anybody feel unclear about what the work looks like for the board, just generally? Does anybody have any additional concerns? And again, we've gotten some really great feedback. Staff will come back with some more details and more of a plan, but I want to be sure you all feel comfortable. Okay, John?
Yeah, I just do feel a little bit uncomfortable on behalf of HPQMC that, you know, this is moving them into commercial, into Medicare, and, you know, in beyond health plan measurement. And I'm assuming OHA is marshaling up the resources to, you know, help sort that out. I mean, it's going to be an interesting measurement issue. And that's kind of assuming somebody else does the cost stuff. This cost itself is really tricky. So.
Can I make a quick plug for that in response to John? We are doing an introductory conversation with HPQMC on Tuesday to present the 889 work and the request for collaboration. So that'll be the introduction, and we plan to present some parameters for the request. So John, to your point, it does not include asking HPQMC to measure cost for the cost growth target program. And it is not focused on provider level measurement at this time, only plan level measurement. So pitch if anyone wants to listen in on Tuesday.
Okay. Okay. So we wanted to have the same kind of conversation around the waiver, and then we'll take a short break before we have the conversation about equity as well as other work. Although, as we've mentioned, sort of equity continues, it's not sort of set over here, but it's both integrated and elevated in these discussions. so want to shift to the conversation about the waiver renewal and the board's role in that. And again, just as there was for the cost growth target work, we have sort of proposal for discussion. And I think staff, either Trilby, Jeremy, and or Steph, I'm not sure who's walking through this, will pull up that and talk about the same sort of thing. Here's some proposed ideas. And so just as we launch into this, just to see if as leader, a collaborator, supporter, to lift up again if there's a sense of who are we leading, who are we collaborating with, who are we supporting. If there's some general ideas, that would be really helpful too as we have this conversation. So I'll turn it over to you all now.
I am going to walk through this. This is Steph.
So Steph, I can't hear you very well. I don't know if anyone else.
Let me get everything all
Much
set.
better, thank you.
No worries. So Michelle, if you want to go to the next slide, that would be great. I'm just going to walk through this, but I welcome Trilby, Jeremy, Pat, jumping in whenever you want on this. So we're starting to get a little bit more familiar with these terms. If you go to the next slide, so for the waiver work, we had the waiver 101 conversation previously. We, February 9th, last week. Time is escaping me. So you had that waiver 101. I'm hoping I know that many of you were able to join, and those that didn't, you can always go back and watch it, perhaps with some, fresh thoughts in mind. I think part of what we are doing now is we are organizing to embark upon what this looks like going forward. So in terms of the different roles that we've been able to identify, and the same thing, we're trying to group it by roles, so it's not necessarily by quarter. We welcome feedback. This is just a draft, but I think these are some potential opportunities. So the first one, and this goes to some of the conversation we've already had today, and part of what Pat was saying is this really overarching role that the board has and is around ensuring alignment with CCO 2.0 and our overall transformation goals. We see the board as absolutely having a leadership role here, being able to check against, the history of what we've done so far in Oregon to say, here's what we are attempting with CCO 2.0. Does the general direction of the waiver, whatever the policies are that are going to come forward, that type of conversation, does this get us further in our goals towards CCO 2.0, towards transformation, towards our end goal, in 2030 of eliminating health inequities? So truly having a leadership space to be able to have those big, really system-wide conversation to understand what we're trying to do in our health system transformation overall. The second space that we see here is to say, okay, you have this overarching view, but then you also have a leadership role in dialing that down to say each of your committees or some of your committees or one or two of your committees may have a more specific opportunity to dig in, to go a little bit deeper in the weeds, to use that expertise that each of your committees offer. And so we're hoping that the board will be able to identify, charge your committees in some cases with a role within the waiver. I realize a lot of this is fuzzy, so I'm going to ask you all to, this is really, we're in the planning stages here. So that would be a leadership opportunity for you to be able to say, this is what we're looking for with the waiver. In terms of collaboration, and again, thinking about this as saying you have an active role in this work, that we would see you as guiding and offering direction. We know that individually and collectively, each of you offers expertise that we think will bring a lot of value to the policy development space. So a lot of that work will be, we'll have subject matter experts helping with the policy design, really getting in the weeds and all of that, but really saying, oh, here's an opportunity to run something by an individual board member or to bring to the board generally or more collectively to say, let's really have this conversation, what's the nuance here, or what direction do you see? And going back to that first that first piece of ensuring alignment. Does this really align? What policy expertise can you bring to this conversation that helps us understand the direction we're going? We also anticipate that there will be a lot of collaboration when information is coming back from the committees. So if you're charging a committee, we've talked loosely about what committees may have a larger role. For example, the MAC. The MAC has a required role, the Medicaid Advisory Committee, in the waiver and ensuring that they're getting feedback from consumers about the waiver process. So what is the board going to do with that? How, what do you take from that? How do you distill that and offer additional feedback to OHA from your perspective on what your committees have brought forward to you? As a supporter, our final vision will be made better by having the board endorse it. We want to ensure that the board is fully in support of the final direction that we're going to go. This is, again, of course, across the entire year right now. Our current application would be, submitted sometime in Q4 currently. And then I think there's a humongous communication role that the board can play. And for anybody who is part of CCO 2.0, you would remember that we had these monthly updates on CCO 2.0, status updates. A lot of that serves the purposes of being a space where everybody knows that they can tune in to the board meetings, get an update on it. The board members can ask their questions. You can really understand, what's the status of the project, how is it going? And that last piece as well about community engagement opportunities. So really being a space where people can get information on a monthly basis in a pretty reliable way. So Jeremy, Trilby, anything you would add to that in general about the waiver and the role of the board? Like I said, I think we're gonna have the same discussion about whether or not this is representative or what you all expected, and I'll let Diana lead that conversation, but anything else before we jump into that?
Steph, I think that was a great overview of the different roles. And the only thing I would emphasize a little bit even more is that in that very first leadership opportunity to ensure alignment with CCO 2.0 and transformation goals, to really emphasize there the equity goal. And I know you mentioned it, and I just feel like in ways we should have actually put it in writing here, because I think that is the charge that came in the governor's letter. That is the goal that we all have as our North Star, as Pat put it, it is the work that we are doing. So to really help ensure that the waiver likewise uses that North Star, elevates that as the focus of the entire piece of work. So just to emphasize that a bit more is the only thing that I would add.
The only thing I would add is, and we talked about this at the webinar last week, I don't think this should be seen as like we did CCO 2.0, that's done. Now we're going to have a whole brand new conversation around the vision of transformation for the waiver. I think these are building on one another. And so really thinking about, CCO 2.0 set some broad vision. We've got some learnings over the last year from COVID, but the waiver I see as kind of the another implementation step of CCO 2.0 and starting to build the path to steps after that. Folks don't always, the waiver is kind of mysterious. I think to most folks, they know we have a waiver. They don't really know what's in it. There's only really 7 regulations that we waived, and they're, and then there's lots of description of stuff that we're doing in order to, in exchange for getting that waiver. But it's not like we needed a waiver for all components of CCOs. We really needed it for a couple of discrete things, not having statewide plans, having the prioritized list, be able to do mandatory enrollment. And then we described to CMS all the things that we think are wonderful that'll be about this model in order to get that flexibility. So just we encourage folks to think about this. I don't think this is about incorporating all 60 things from CCO 2.0 plus another 40. I think this is really around picking a couple of those kind of high value things that really help us get additional flexibility to move the model forward. And thinking about what are those couple of big things that we could really do that really help us move things forward.
Not only is the waiver mysterious, it's also magical. It allows you to suspend laws of physics and finance and human anatomy and bunches of other things if you can just get it in your waiver.
David, please, and then Oscar.
Jeremy, how much of the waiver do you think will overlap with the prior waiver, and how much is new in your best guess? And it might be helpful for us, if there is sufficient overlap, just to share the prior waiver with us so we can get a look at what the final product looks like. Because this all makes perfect sense, you know, I support it, but it'd be nice to see, you know, what we're striving for.
Yeah, we'd be happy to send it around. It's about 300 pages, so you know, read it at your in your leisure. You know, if you're having trouble sleeping at night. But you know, it's 4 pages of it are actually the waiver. You know, that describe the regulations that we need to waive, and then 296 pages of it are a description of how we're going to run our program and why we want these waivers. So we're happy to send it around. The way that it's really generally works is we're really renewing it and continuing to fine tune it. So it's not like we're scrapping it and starting from scratch. And that's part of the reason it's 300 pages is because we tend to just keep adding more pages to it. But generally, this has been around since 1994 when we first started to have managed care, and that was a brand new thing in the Medicaid space, and we had the prioritized list, and it has evolved. And as you read through it, you'll see that because there's actually first section of it is a history, and it describes each change that we've had each time we've renewed the waivers. But so largely it'll be you know, taking what we have right now, modifying it based off of things that are irrelevant or have changed, and then adding some new things based off of where we're trying to go to next. So so it'll be I mean, we get to the point where we literally are doing red line edits with CMS, and we want to cut this section, we want to add this section. But we'll send it around to folks, and I think it'll make sense. And there's actually, if there's one piece I would read it at the beginning, it's the first 30 or 40 pages of it, or maybe it's not even that long, that gives a pretty good his kind of historic summary of the Oregon Health Plan generally, going back to the early 80s and 90s, and you can just see kind of how the model has evolved over time. And I think that would be useful information.
If you send it around with in the email, say, you know, the sections A, B, and C are the ones you should pay attention to, it'd be helpful for me to understand where we're headed.
Yep, absolutely.
Oscar, please, and then John. Go ahead, Oscar.
Yeah, I would love for us to really reconsider, you know, our communicator role around community engagement opportunities for the board and potentially staff, and sort of maybe kind of heighten that to a higher level. The governor's letter to us really calls out and asks us to make sure that the policies that we sort of move forward are really informed by community. So I'm looking at our little framework here, and you know, the role of communicator says that we're not actively involved in development or guidance. So I'd love for us to really reconsider a little bit of a higher role in terms of community engagement, and you know, sort of guiding a much more strategic approach to how do we reach the folks that are going to be most impacted by this.
Oscar, can you give an example? So that's a great point. What might that look like? So we can get that specific.
Yeah, I mean, I guess I would love to understand like what is like the current strategy in terms of community engagement around this, and to sort of be able to provide input and feedback around that community engagement strategy.
Any additional thoughts on that? Or Jeremy, Trilby, have thoughts or reactions to that?
I mean, I think, yeah, so first of all, we're still kind of building out the community engagement plan for the year. And I think that's certainly something we would love to work with the board on and make sure you've got both visibility into that, but also can help support it. And yeah, I mean, I think it would be a good ongoing conversation, figure out how we can support that together.
And I'll just add, you know, I think one of the things we're trying to be really conscious of when it comes to community engagement is that we've spent a couple of years doing pretty intensive community engagement around our OHA strategic plan and CCO 2.0. So we certainly want to take what we've heard and not go back out and say, what are your ideas here? What are the challenges? Because we have been hearing all those challenges. And so we're really trying to apply that and say the waiver should be addressing the challenges that we've been hearing about. I think what we would want to see is that we want to make sure that we are confirming with the community and with those who are impacted that, is this actually going to address the things that you've raised in the past? So I think that there's quite a bit that, we can certainly work with you all and co-create around what are the questions we're asking, what are the communities we should be reaching. And I think that's another space where we really see, like, what are the roles of your committees who do some of this other community engagement work as well? What role can the MAC play? What role can the HEC play, or other committees or other efforts to really kind of, leverage other existing opportunities to reach out to the community?
Great. Other thoughts on the proposal? John, please.
Yeah, my sense, as you've emphasized, Jeremy, is that when it comes down to it, there's really a fairly manageable set of ideas that are in play. And the question oftentimes is, is this the right time and place for a big idea? I mean, Oregon has done several big ideas in its history of waivers, and I think it's also had times when it said, we're just going to go with what we've continued. We're going to continue what we are doing, but this isn't a time we want to do something big. I mean, the Trump administration had its set of ideas, and some states went for waivers around those. My guess is the Biden administration, there's probably conversations around what kind of waiver ideas may they be receptive to and or not receptive to. And I think for myself, I think it would be interesting to have a sense of that if and when you can. I mean, is there an eligibility idea that the Biden administration is receptive to? Is there a delivery system, something that would further the transformation, for example, in primary care that we did so much of under the previous waivers. It's those ideas, I think, that are interesting and really make a big difference oftentimes. So.
Thanks, John. I want to be clear that when I say I think our list of asks, from a strategic standpoint, should be somewhat narrow. I don't know what the magic number is, but not 45 or 60. I don't want that to be interpreted as not big and bold. I actually think it's the opposite. I think it's, if you go in asking for 25 things, they're going to turn around and say, what are the 3 you really want to do? And I think this is about us picking those couple of things or few things, whatever they are, that are the things that now there's really an opportunity to make a big lift and move the model forward in a big way. So I don't want to, I think by keeping it somewhat of a narrow focus is actually about trying to think of those things that we get the biggest return on, and that there isn't a big opportunity to move forward that are big and bold. I think when people talk about big and bold, the way where I think they're trying to figure out what's Medicaid versus what's something else. It's now the time we're going to have a conversation around expanding coverage, getting shoring up more stuff for the marketplace, and that kind of remains to be seen right now with CMS on whether those things could come in. Right now the waiver's focused on Medicaid and really moving the Medicaid delivery system forward. And certainly we could think about things like, eligibility with the Medicaid, but to date they have kept marketplace, issues and Medicaid separate, 2 separate waivers, 2 separate paths, different 8 parts of the agency. That might change, but right now that's where they're at. Yesterday, it's not official, but yesterday, the kind of the next level of rumor mill is out that Chiquita Brooks-LaSure will be appointed CMS administrator. She has a long history in commercial market. She was worked for the Obama administration through AC implementation, more on the commercial side. She actually worked with us at Manette Health on our public option work over the last year, so she knows Oregon's model really well. I think all signals are that their immediate focus is going to be on shoring up the ACA, shoring up the marketplace, trying to get states that haven't done the Medicaid expansion to do the expansion and COVID response. And the extent of their Medicaid interest right now immediately might be trying to get those remaining states to do the expansion. So part of, I think, what we're going to be wanting to kind of work with the administration on is kind of where their priorities. If they want to start first with ACA expansion and shoring up coverage, that might change our trajectory. Do we want to start kind of there with some conversations with them and then come back to Medicaid to follow? So that kind of remains to be seen. It's been a big question mark because we haven't known who we're going to be working with. It's exciting that all of the names that have been floating over the last couple of months are all folks that are pretty familiar with Oregon and folks we've worked with, which is great. But I think, John, to the point of, is there a bigger play here outside of Medicaid? That's really going to come down to, I think, CMS and how they've thought about these waivers. And to date, they've kind of kept Medicaid and non-Medicaid stuff separate. Doesn't mean we can't be on two different paths, but we have to kind of work through those different paths at the moment.
Yeah, I actually wasn't talking about outside of Medicaid. I mean, I was wondering whether, given COVID and the catastrophe it's been for small business, for individual employed folks, are they open to helping those folks through Medicaid? There's a lot more people in need now because of COVID than there were before. So are they open to eligibility stuff based on that?
Congress did open eligibility to the Compact Free Association population that was categorically excluded back in the 90s. And that's a pretty significant step that maybe indicates what some of the appetite is. I think there's also a lot of interest when you think about the individual market to think about a public option. And the simplest way to do a public option is some kind of a Medicaid buy-in, unless you do a big tax credit expansion for the individual market, which is also feasible too, but I think less effective.
Other comments or questions about the waiver renewal work? Anything missing? I mean, Oscar raised this great point about community engagement. Are there other things that you feel like you want to lift up, or anything missing, or anything that doesn't resonate? You feel like you have clarity on this work? I mean, knowing, as Jeremy's talking, like there's going to be evolution and shifting and changing, and there's still unknowns. But do you have clarity on what your role might look like? Yeah.
Pending 300 pages of reading, yes.
Or maybe 4 pages of reading, whichever one you choose. But yeah, that's something we'll get out and make sure you guys get. Anything else on this work? Okay, we are scheduled to take a 10-minute break. We will come back at 11:15. We'll be, again, sort of lifting up and focusing on on health equity, and then sort of talking in our last hour or so about past priorities and other priorities discussion. I want to, so that's where we'll land by 1 o'clock. Want to really appreciate the discussion and the authentic engagement and the sort of what you all are bringing to the conversation. So thanks so much for that. And let's come back together at, what did I say? 11:15.
And I will need again to step away from 11:30 to 12:15, but then I'll be back for the rest of the meeting.
Thanks so much, Pat. So we'll see y'all at 11:15. I think we're just waiting for Brenda, but I think she'll join us in a moment. I'm just want to frame this for a minute, and then I'm actually going to turn it over to Trilby and Leanne Johnson. You know, we've been talking about the centrality of equity throughout the conversation yesterday and today, and how important that is for the state, for the board's work. And, you know, using that equity first lens on what we want to sort of turn to is sort of thinking broadly about what does the board's work look like on equity, and specifically with a specific emphasis around 889 and the waiver. And how do we sort of ensure that this work is first and foremost and central to, as you do this work, and how do you all, and I think this will be part of the conversation, sort of best utilize the Health Equity Committee, and how do you utilize their work and utilize them as you do this work around 889 and the waiver. So I'm going to turn it over to Trilby and Leanne, sort of additionally frame up this conversation.
Great, thank you, Diana. Leanne, would you like to go first, or would you like me to do a little, make some comments initially, and then you jump in? What's your preference?
You go first, Trilby. Thank you.
Okay. Well, I'm grateful to have this opportunity to try to weave some of this together, because for me, that has been really, really important to do throughout all the time we've been spending together in this retreat. And happily, I think it's happened somewhat organically, right? That equity has continued to rise up for us. We've continued to elevate it. The committee's elevated it. And that is as it should be. So I'm really feeling excited about the way this is coming up in our conversation and our work. I thought there might be 3 things I could do that could be helpful to launch this conversation. And first, it would be to touch on briefly the ways in which the committee chairs yesterday spoke to this, because they all did this for me in a very powerful way. And I assume that it registered for all of you, and maybe seeing it woven together a little bit would be helpful. I think the committee work stands out as a huge area of work for this board, figuring out how best to manage that, harness that energy, and use it to drive forward our work on these priority areas. And then to come back around to talking about equity within 889 and within the waiver work, and just touch briefly there on some of the major pieces of work that would rise up when we think about equity in those initiatives. So turning first to the committees, you know, the Health Plan Quality Metrics Committee emphasized quite a bit how good they felt about having a health equity measure. And I do want to just mention briefly that although, you know, John, I think you referenced at some point that yes, that was a good first step, but that wasn't the hard part. It actually was a tremendous step forward in that it is a health equity measure that really looks at the structure of the system and really helps us begin to make a change in a structure that has not been responsive to communities where English is not the first language, or where there's a different cultural context for receiving services. So I think that's something that that committee is feeling very good about, and really helps us understand how they have put equity first and foremost. And then they also shared their concerns about data collection and how that is not something they feel they have the capacity to do in the way that will really help them move forward to consider other measures. And that, of course, that theme kept coming up around data. Metrics and scoring, you know, to hear them talk about how they want to evolve beyond medical models for measurement as they move forward. I mean, that was very intriguing. And it's exciting when we think about social determinants of health and how central that is to work on equity. So really looking forward to us tapping into that work on their part. And then, of course, the Health Equity Committee came in and said, really offered themselves up to say, we want to help advise this board in the areas in which you need guidance on equity. So really opening themselves up to hearing from you on where you want them to focus. Of course, they've been doing some tremendous work giving us the health equity definition, also preparing a toolkit for committees. And they mentioned workforce diversification as an important area for them, which of course connects really nicely to both what the Patient-Centered Primary Care Collaborative talked about in mentioning models for traditional health workers, and also what the Workforce Committee spoke to about traditional health workers and the need to really focus there in supporting in expansion of our healthcare workforce. The MAC, of course, you know, fascinating to hear from them for the first time here on the board. They seem very excited about having the linkage here and very invested in holding up a community lens to our review of CCO 2.0, which I think is going to be of huge value to us. The consumer experience with CCO 2.0. And they will also be the committee where the evaluation of CCO 2.0 is presented. So they will get a lot of really interesting data about how well CCO 2.0 performed in some of the areas where we set ambitious goals. So they also, of course, emphasized their connection to the CACs, which is another important way for us to be hearing back from community. I think I jumped over FAB. You know, in many ways, FAB is ahead of some of the rest of us in having done health equity reviews of their policies and procedures, you know, in their work on Healthier Together Oregon, really stepping out to put racism front and center and really lead with race in their work. So they are very well poised to help us pull these threads together. And then finally, High Talk. You know, that is a committee that it would seem is off in the weeds on HIE and very technical, but they spoke to a couple of really powerful things, I thought. And one of them, that's the group that's been talking to providers again about data. You know, how do we improve on Real D? How do we really bring some of that critical data into play? And they've identified barriers there, and they're talking about a patient portal, you know, and these are ideas, again, that I think can really help us move equity forward to explore some of those ideas and conversations. So much good work going on in the committees. And then thinking about how this board encourages that, highlights that, utilizes that is part of our work, I think, to address the equity theme. It may be, you know, I'm remembering back on Oscar's thoughts of, do we just have a charge to the committees that is sort of a generic charge on wanting them to raise up these kinds of projects, wanting to hear back on these kinds of projects in particular? Giving some thought to that, I think, could be really interesting as part of our discussion. And then finally, just to touch on 889 and waiver. I think we already surfaced a lot of really powerful opportunities within those two initiatives for this board to lead and emphasize equity. 889, really the whole healthcare cost growth target work is about that really difficult reallocation of resources. And I think both Pat and Jeremy really emphasize that in a powerful way. And then it has that thread of unintended consequences. You know, really taking care to monitor that as we look at overall total cost of care, there aren't some unintended things happening around access, around quality. And how do we look for those things and take care for those flags with equity in mind? You know, really fashioning a framework there that will help ensure that we don't unintentionally worsen disparities as we try to reallocate on a grand scale. So I think those are going to be really meaty things for the board to lean into. On waiver, you know, the conversation is really just beginning on what will be the ideas, the concepts that we need to push on and move forward and take to another level from CCO 2.0. And likewise, as we think about being bold in some areas there, how do we monitor for any unintended consequences? How do we ensure that we're making progress toward equity? Do a better job of that moving forward, which brings us right back around to measurement and data and those challenges that we've had that many of our committees seem poised to take on. The MAC, the HPQMC and metrics and scoring, and workforce to look at diversification and of course the Health Equity Committee itself. So I hope this is helpful in just raising some topics for conversation. It's a richness that I'm just really thrilled to see, these opportunities and these threads that we have to elevate equity, to really make that the work in both oversight of committees, the 889 work, and the waiver work. So I'll stop there and open it up for Leanne.
Thank you. Thank you, Trilby. Good morning, everyone. Couldn't have said it better. Not that much to add, especially underscoring what, I should say, I'm Leanne Johnson, Director of Equity and Inclusion Division, for anyone that that's listening that doesn't know me. So anyway, the fact that you as a board have been talking about equity, integrating that conversation throughout, I think is very notable, and I very much appreciate that. And I think that that gets us much further down the road on this conversation. So not that much more for me to add at this point in time. I do want to underscore a couple of things. And Trilby, I appreciate you brought us back to measurement and data. And I would also add to that community as well, that, you know, we can look at those data and we can see, hopefully start to see movement on closing the gap on those disparities. And for me, and for the work we do in equity and inclusion, it's when community says we're there, we're there. And that's what's going to be most important, is to get that qualitative feedback along the way to adjust accordingly. And then when we get to that 2030 milestone, we're not there until community says that we are there. So I just want to underscore that as well. So relating to that 2030 goal of eliminating health inequities, one of the exercises that we've been going through as an agency, as Pat has pointed out, is really looking at that from the standpoint of our health equity definition, the allocation and reallocation of resources and power, and really in every conversation, really working to integrate into every conversation, into every decision. Does this direction get us closer to that goal, take us away from that goal, or is it neutral? And we're no longer satisfied, of course, with taking away from the goal, and we're not even satisfied with neutral. We've got to really be saying, how does this work affirmatively get us towards that 2030 goal? So that's really critical. And once again, the community piece is so important on that, the work throughout, and our accountability to their satisfaction, not to our satisfaction as a government agency. Let's see, from there, I will go to some of the committee conversations, and really appreciated yesterday metrics and scoring, I believe it was, that took the measurements all the way back as far upstream as we can get. This is not to take away from the medical model, from the public health model, but it is to say that the equity and inclusion model encompasses all of that. So the further upstream we go, we will be, and that furthest upstream place that we are going is 529 years back to the fact that this land that we are on, the government that has been built around this land, is this land was taken, and that from there on out, policies and practice has been put in place to uphold that 529 years of oppression. And so we've got to go all the way back to anti-racism, anti-oppression, and to decolonize the way we do our work. So that's a really critical piece and conversation that we've been having in our work in the agency and in equity inclusion. So I appreciate that Pat noting that in 2018 is when we really started taking this on, day in, day out, minute by minute, with practice, and not just from a values perspective. And I think in that we have to remember that this work in the agency or in the state really began in 1993 with the Minority Health office model in public health. And so so while we can point to 2018, we have to remember all of the people that came before us that did when Director Allen and Pat talked about how hard the work is, and did this work in circumstances that are much harder than they are now. And we're talking about in this state, the public health minority health office model, but of course, once again, we're talking about those centuries of oppression and racism. So we can't forget that. And then finally, I think I will, let's see, where is my number 4? Oh, unintended consequences, absolutely. We need to be looking at that. And then finally, I would say when we talk about the reallocation of resources and power, while resources might be limited, because that's the reality, power is not a scarce commodity, but we treat it as such. And so when I say power is not a scarce commodity, one of the things that we are working to do, that I am working to do, is figure out how in the heck do we liberate ourselves outside of this colonization of our work and outside of the colonization of thinking that brings us to these scarcity points. And when you get to the scarcity points, then you've got people, communities, and communities are set up in that to push back against each other. That conflict has been critical in upholding colonization and upholding white supremacy. So we've got to not fall prey to those dynamics and understand that that power is not scarce, but how we think about it, and then our behaviors and our actions, our decisions from that point create those scarcities. So I'm really encouraging, and I don't think I have to encourage, because I just so appreciate the conversations you've been having and the very mature way that you're thinking about all this work. And I would just ask us to continue to really push those boundaries, push those limits, and understand that we have the power. We have the power to move this forward. And I appreciate not only the work you're doing for remaining relevant to this work, but the what seems to be behind that, and that is remaining relevant to this work for the purpose of doing good for all people in the state of Oregon. So it's not an exercise in how does this committee stay relevant, it's how do you stay relevant to make a difference. And that is really what I have been hearing and seeing since in this conversation yesterday and today. And I just extend my deepest gratitude and extend the partnership for us to continue to work together. So thank you.
Leanne, thank you so much. Trilby, really appreciate it, both of your comments in terms of grounding us for this discussion. Given that sort of framing, as well as the conversation we've had yesterday and today, and that you all have been having for quite a while now, we want to sort of just get from you, board, sort of what is your perspective in terms of continuing to elevate and integrate this work? We want to talk specifically about 889 and the waiver, but know that it's more than that, right? So just want to hear some sort of reactions and thoughts to some of the framing that Leanne and Trilby have done, and also just to sort of start moving us to, so what does the work look like? How do you continue to lift this work up and center it? So let me just open it up for board discussion.
So I have a question. I feel like my comments are like a little off topic, but I'm gonna go ahead and put it out there anyway. So I know that, so much of this work, clearly, we understand, the role and the responsibility of the board. We understand the significance of, the work also being driven by the community and by the consumers. And then there's the various board committee chairs. And then, so I guess my question is, So I think about all of this, you know, kind of all happening simultaneously, and we're all holding our piece of the puzzle specific to, you know, bringing forth kind of the equity lens in what we do. Just one question is, and so I know that, you know, for example, Leanne, you know, I think about all of the different teams and units within OHA. You know, how is the equity effort also moving on that side to move the work forward so that we're all kind of, you know, going in the same direction? And one piece that, you know, I haven't heard about, which maybe it's not necessarily our focus, but I think internally to just OHA, how and what happens with kind of internal staff around bringing them along in terms of integrating the equity priorities and values in their work. Does that make sense?
Yes, it makes absolute sense, and I'm more than happy to jump in and speak to that if that's appropriate. So when we talk about the 10-year goal and the health equity definition and the anti-racism framework, that's the intersection of the work that we are beginning to hold. I can't say that we've done an excellent job at this as of yet, but we will. Is holding people accountable to that. So we've brought in around the strategic planning work, for example, we've brought in anti-racism training and anti-racism development for the leadership team and for the team that is moving the strategic plan work forward. That conversation and that accountability and those and I don't want to say just training, because it's not just a training, which is why I'm trying to avoid that word, but it's a developmental process. So this is not going to be like a metric that sounds fabulous, but I'm going to put it out there because I think it's important to kind of see where we've come from and how much more we have to do. So we have about 4,400 employees in the Oregon Health Authority. And at this point in time, 400 have started that developmental process around anti-racism, including the entire OHA leadership team. And we have monthly sessions. Maybe they're every other week now. Sorry, COVID time, but we have sessions on a regular basis with our anti-racism teachers, if you will, about how do we as leaders, how do we lead for this? How do we hold ourselves accountable? And then how do we hold our teams accountable? So that's the foundation, the framework by which we are moving forward. We're just at the beginning phases of that. And we have to also look at, I think, in that our hiring processes and just how do we continue to build a workforce that is reflective of our community and that is reflective of the values that we are putting forward, and not only the values but the practice as well. So I'll stop there, and if you have any other follow-up questions, we'd be happy to answer that. That's where the accountability is, where it sits currently.
Kirsten, go ahead, and then Brenda.
I have a related question. I was wondering if the OHA staff that work on the various OHPB committees are part of that 400 or in part of that training.
Yeah, it could be. It's not intentionally, but they might be part of other groups that have gotten that training. So, for example, the group that's working on strategic planning is a cross-agency group. So there's perhaps some connection and a nexus there. All of our equity and inclusion team has gotten the training. So I cannot say specifically if everyone that staffs committees has gotten the training, because we have not done the deliberate reach out to those. And that is an excellent idea, I think, as we move forward, because we are starting to say, okay, this group of people next, this group of people next. And so it's teams. It might be discrete teams that are getting the training, you know, per their manager, per their director, or it could be people that are cross-cutting, you know, and serving a specific function for the agency. For example, our community engagement coordinators across the agency were some of the first out of the gate to get this as part of our community engagement work that we did around strategic planning. So two things. I think that's a great idea. We should make sure that that has happened. And some of them may have gotten it because they are part of another effort or another team.
Right, and I could just add, Kirsten, that HPA is going to be prioritizing this with within our own budget, just to speed up, making sure that staff at HPA has all had access to these trainings. So that will be happening in the near future for anybody who hasn't picked it up as some of these priority groups that Leanne was talking about. I shouldn't call them priority, but some of these initial groups, which would also include bill analysts and bill managers. So that picks up a lot of HPA staff. Most of the committee staff are HPA staff.
Brenda.
Thanks. I've got 3 thoughts. The first is connected to the presentation as it related to the cost growth target and the use of the word unintended consequences. And I wonder if we can talk about it and sort of reframe our thinking about them being equity consequences and refrain from unintended, just because I think that may let us all off the hook a bit. The second comment was around, I loved, Leanne, how you talked about the use of power and sort of the generative way that you're talking about it. And I'm thinking about yesterday's conversation with the Health Equity Committee, and I want to make sure that our planning processes are really deeply listening to what the committees want of this board. And what I hear sometimes is that the committees are waiting for board direction. And so this is more just because we're talking in retreat about how those groups inform one another, and that we think about our role as deeply listening to the advice and counsel of the Health Equity Committee as well as we do the rest of our committees. And then my third question or comment is really around whether or not, and I love that you refrain from saying training because I think that's so powerful, but like the human development of this work and how we do that, not only for our staff, but we think about it for our committee members and we think about it for this board. So whether those opportunities are more deliberately opened up to those that aren't direct, at least the invitation to participate for other groups like this one. Thanks.
Thank you. I will stop using unintended consequences. I appreciate that very much because it starts to, after a while, after hundreds of years of this, it starts to feel kind of intentional to some degrees, especially. So appreciate that very much. I appreciate all the comments. And I think we have to recognize that when the system is left to its own implicit devices, it will default. Which to bias and to structural racism. So I think that there's something about that is very intentional, and I like equity consequences. So thank you.
John, go ahead.
Yeah, thanks for your comments, you guys. Leanne, your comments reminded me of the Metrics and Scoring Committee meeting in which the committee unanimously voted that the interpreter measure would be part of the incentives. I think in large part that happened because you and your team arranged and enabled some of the most compelling testimony that committee has heard. When you said a few minutes ago, when the community says we are there, we're there. And I think what happened at that committee meeting is the community said to Metrics and Scoring, we're there. Say yes. And they did. By the way, there was another measure that day that they did not say yes to. And I think in part, there wasn't a community that, made as powerful a statement. So the reason I'm asking is, as we approach this task in 889, is there a way, perhaps it's through the equity committee, but it may be a big ask for them. Is there a way that we can brainstorm with the community as we do this, and in some way get confirmation that we're getting there as we move forward. I hope that made sense.
It makes sense to me, and thank you. Yes, and thanks for taking us back to that moment, and the community have the impact and made the difference. So I'm also, I think, pondering what Steph Jerem said earlier about that the community has been has said we've told you what we need, now now do it, right? So there's that piece of it as well, and I think that ongoing dialogue is part of it. The ongoing dialogue and ongoing checkpoints are really part of the business of the Equity Inclusion Division, the Community Partner Outreach Program, the State Health Improvement Plan work, Healthy Together Oregon, all of the CCO 2.0. There's just been a thread of that work, of those connections, those relationships throughout. So I think what we need to do is that needs to be just a broader, larger scale. And I think we're starting to see that expand from the very specific, and tribal affairs as well, pardon me, from the very specific programs that have been equity focused, and we're seeing how that is expanding in terms of community engagement and community relationship into all the work that we're doing. So yes, those, there's the checkpoints, there's the input, but then there are the relationships that make this less burdensome for community, because we're doing this as a course of our business, as a course of our relationships, as opposed to making it something off to the side that's special for this situation. So we have to, I think we just have to, yes to your question, and we've got to figure out how we do that in a way that continues to be authentic and continues to follow the model that has been put out there by Tribal Affairs, by Community Partner Outreach Program, and by the Equity and Inclusion Division.
So David, then Trilby, and then Oscar.
Probably Trilby and Oscar were first. Let them go first.
Okay, sorry, I didn't see them first. Go ahead. Trilby, then Oscar, then David.
Okay, thanks. I just really wanted to double down on what Leanne is saying, and perhaps connect that a little bit to Oscar's comment about, on waiver, what is the role for the board on community engagement? And could we elevate that role so that we're weighing in a bit more on the plan for community engagement? And I think that, Leanne, you've really underscored in ways that we have a conversation going on, parts of OHA do, that has really asked a lot of community in terms of asking for their ongoing engagement. And there are meetings, a series of meetings that have been scheduled and that have been honored to keep this conversation going. And it's very much our intent to stand on the shoulders of that hard work, both by community and by these parts of OHA, OEI, the Community Partnership and Outreach Program, and the work of public health around COVID and Healthier Together Oregon, to really use that structure to getting questions about waiver, to share information about waiver, and to be guided in the decisions that we need to make about waiver. So that's part of the plan that you'll see when we do bring that forward. And I think it's really important to honor the fact that we have asked some of these questions, and that we have a responsibility now to come back and say, okay, we've listened, and here's what we're proposing to keep that conversation going.
Oscar, please.
Yeah, I think my question kind of connects back to our earlier conversation today regarding redistribution of resources, reallocation of resources. And, we're talking about health equity as being one of our priorities. We're talking about this big goal of ending health inequities in 2030. And I think I've also heard that the Health Equity Committee is looking for, sort of like guidance in terms of like, what do you want us to focus on? I'd be really interested to hear from the Health Equity Committee on what will it take? What are the resources needed, and how do we allocate resources to make sure that we meet these goals? We can't just sort of like say that this is a big priority and not allocate resources to it and expect to have changes. Like we can't just say, oh, this is really important and things are going to continue the same way in terms of resources being how the way resources are used. So I'm curious to hear your thoughts around that, and wondering if this is like something that the Health Equity Committee would be interested in looking at.
I can speak. I didn't know if you were directing that at me, Oscar. I'm sorry.
Go ahead, Leanne.
Yes, yes.
Okay. Thank you. Well, and I think yesterday, Dr. Derek Duvivier did touch upon this. He said, yeah, why don't you ask the people that are doing the work in the agency, how those resources are going. And Director Allen has spoken to this before of holding harmless in those budget cut times as a result of COVID, most recent round, that a variety of equity related programs were held harmless, which we appreciate, absolutely. And we also have policy option packages going forward in both tribal affairs and Equity Inclusion Division, and then the Community Partner Outreach Program also had an infusion of some additional staffing, and they of course are doing that community engagement throughout the entire state. So yes, we need absolutely need more resources. The policy option package that we're put forward for Equity Inclusion Division is really only a right size package. To get to sort of where we are, what we need now. And we worked also with Health Policy and Analytics on some collaboration around community engagement and how we manage that going here on out. So, and then the governor's budget does indeed have some infusion of resources into the equity inclusion work. So all that said, we're on the pathway there, but these decisions are now, they're not in our hands, they're in the hands of the legislature. But indeed, if we're looking at that 2030 goal, we need more equity related expertise and people doing that work and helping infuse and integrate equity work throughout practice throughout the entire agency. And I appreciate the acknowledgement that that just doesn't happen. Budget, human resources, communications, risk management, all of those are disciplines, and we rely upon people with expertise to help us do that. There's no way I can, I can't figure out I can read a budget and figure out what I can spend, but I don't know the back structure of that. So the same as with equity inclusion. It takes people, it takes expertise, it takes resources. And I think we're pushing in that direction, and really absolutely appreciate the more voices in understanding that and expressing that. So that's my take on it at this point in time. The answer is yes, we need more to put it in a short answer.
Thank you, Leanne. Go ahead, David.
Thanks, Leanne and Trilby, for the discussion. When I was reviewing the materials, the letter from the HEC to the Oregon Health Policy Board talks about an equity action plan. And in that letter, it's in the context of COVID. But then in subsequent discussions with Kate and Derek and our statement around racism being a public health crisis, there was discussion about an equity action plan being more of a statewide plan, that's bigger and larger than COVID. And then there's also the work of the Governor's Social Justice or Racial Justice Council are on this. And so my question for you is, where is the equity action plan? Is that on a list? Is that part of the priorities for the state? Does that live with Racial Justice Council? How do we intersect with it at all? Or are we looking at this really within the lens of cost containment and Medicaid waiver? Or are we touching that at a more macro level?
Thank you, Dr. Bangsberg. I can take that to some degree. And I think that we need to have a much more global equity action plan that is statewide, especially as we've spoken to, all of you have spoken very eloquently to the fact that there are many drivers, and those drivers don't all sit within the health authority. And at the same time, we do have a way to impact, because we are one state system. We should be seeing ourselves as one state system. So I think there's a couple of ways. There's the regional, the Racial Justice Council and the work they're doing, and the Health Equity Committee and OHA. We're plugged into that. I am really taken more. I don't want to say more, so I don't mean it that way, but also I think sometimes there's something we overlook, and that is the State Health Improvement Plan, Now Healthy Together Oregon. I think that is a tremendous vehicle for connecting around the social determinants of health, connecting around the social determinants of equity, connecting, transportation, education, housing, because all of those agencies were involved in that plan. So I think we've got many pieces, and we've got to work diligently to pull those together so that we don't have, so that everything's moving towards the same goal. And I think there's a variety of components that are already in place, and it might be our role to be, and it has been. I mean, Oregon Health Authority has been working to connect those dots.
And I see Trilby and Brenda. David, I wanted to also just see if part of that question was about sort of the board's role in terms of equity and focusing on 889 in the waiver, that there are as Leanne highlighted, all these things happening and all these dots being connected. And was that part of what you were?
I think my question is, it's very clear that we have a priority to address equity as foundational elements of 889 and the waiver. I think we all agree on that. There are these other discussions in the state around more of a statewide plan, this 10-year goal. There's a lot of other people, committees, groups involved in that. Are we, at least for the next 2 years, focusing on 889 and Medicaid waiver and equity as a critical foundation of that work? Or this is not either or, but are we, is there a expectation or a request to work with the Racial Justice Council and other bodies on a larger statewide plan?
So let me see, Leanne, Jeremy, or Trilby. It's like all three of you could probably weigh in on this.
Well, I will, I'll hold my remarks and let Jeremy and Leanne speak to this. I think Leanne probably has the clearest sense of where we are on the statewide work. So you can come back to me, Diana, thanks.
I'm happy to jump in, Leanne, unless you want to go first. Okay, I think that, and Leanne, please jump in if you think that this is not right. I don't think it's an either or. I think that as we're getting some significant things off the ground with 889 and the waiver, make sure those are grounded in equity is a really important role for the board. I also think the board can also keep, holding all of us accountable to equity, whether that's the committee work or other work that's coming before the board by asking us tough questions and making sure that we're really centering that work in equity. And I don't think that means that you necessarily then have to create a health equity agenda statewide that touches all these other areas in order to do that. So I think the board can play a really important role in equity, both in launching these two bodies of work that the governor's asked you to focus on, as well as making sure that it's an integral part of other conversations that are happening with the board. And I don't think that means that you're not keeping it as a priority. And I think that you can do that without feeling the need to say you're the one responsible for some of these broader conversations that are outside of the board's scope or what the governor's asked you to work on. And Leanne, do you agree with that?
I agree, yes. And I've had a lot of airtime, so I also will turn it over to Trilby for anything else you'd like to add.
David, does that get it? You're sort of that great. Okay, Trilby.
Yeah, I guess what I wanted to do is just remind folks that we do have in the materials fairly lengthy document that pulls together a lot of the work that's been going on across OHA, organized according to the requests or recommendations that came to us from the Health Equity Committee. And I think, Dr. Bainsberg, that's one of the places where the Health Equity Plan was referenced, was in those requests or recommendations from the Health Equity Committee. And that was really in the context of COVID. So I think that's the request that came in at that time. And this document is very responsive to say there is this work going on in all these different parts of OHA. And as Pat said early on, and both Jeremy and Leanne have said, that's an area where really the COVID response is taken up in different parts of OHA and is not a response that's needed from the board. And so I really would just echo what Jeremy said in terms of the tremendous potential of 889 and waiver to really help move equity forward, and for this board to achieve clarity on that and to maximize on that. And we will then see that reflected in some of these larger plans like Healthier Together Oregon, which include reference to both of those initiatives as valuable opportunities. So we really, we're there. This work is there in these larger plans. And I think that as we develop the opportunities for really advancing equity, it will play a large role.
Brenda, go ahead.
My comment was just to remind OHA to continue to be courageous in communicating when we are redistributing resources for purposes of health equity. I think sometimes we do the work and it's not quite as transparent to the public, and I'll use vaccination or COVID vaccine distribution as an example, or testing supplies or PPE. If we went back and we said, you know, we actually took deliberate steps as a state to actually engage, and are continuing to do so, engage parts of the delivery system that are focused on health equity and in target populations. And I think the question for us is, you know, how often do we actually say those words out loud, or are we concerned about the public, you know, backlash? So John brought up earlier today about, you know, the pressures around vaccine supply in the population as a whole. Are we afraid of saying the words out loud that we are making deliberate efforts to put vaccine supply in the hands of, you know, the delivery system for specific affected communities or not? And I don't know. I mean, I don't know how courageous we're being or not in that space.
Thank you, Brenda. Go ahead, John. And then I want to make sure we have enough time to talk about these other past priorities, but I want to be make sure we also have ample time to to make sure all of you are heard on this important piece of work. So John, go ahead.
Yeah, two things. First of all, I think earlier we talked about we could benefit from the lessons learned in COVID. You know, I'm stuck in my house dependent on very limited communications, but I think there's been a lot of lessons learned at the Vaccine Advisory Committee. I believe I've tried to listen to Rachel Banks' presentation that the law, such as it is, limited the state's ability to transfer resources. You know, because I'm old, I watch the dashboard every day on how vaccinations are going. And, you know, the number of African Americans vaccinated is not much to be proud of. It's probably better than in other states, percentage-wise, but we're clearly, I mean, you know, we're seeing, you know, the same picture emerge in front of us. And I know the state is trying. I know the state is trying. So there's some lessons learned there. The other thing, a friend sent me House Bill 2337, a House bill from Representative Salinas that gets at equity, gets at measuring, requires contractors to, you know, submit data to the state that includes equity elements. And then, interestingly enough, gets into language issues. You know what? When I read it, it made me, maybe a performance measure to be considered for 889 would be that commercial and Medicare carriers should submit the same measure that Medicare CCOs are. Wouldn't that be interesting to see how well Medicaid, Medicare, and commercial are doing in terms of getting interpreters you know, where they should be. So, you know, we just need to keep thinking how to do this.
Yeah, John, to your point, and I think this came up earlier, it did come up earlier with Pat about what are the lessons learned through COVID that are applicable to centering, to the equity work that you all continue to do. So let me see if there are board members, if you have additional comments, questions, input around the work on this sort of putting equity first and center, and especially with regards to 889 and the waiver and in your oversight of committees. So those are the three strands I'm hearing now. Please, Kirsten.
Yes, I am interested in creating a backstop that helps us hold ourselves accountable, because I think intentions are good here, and I think that still can create hard choices when we are redistributing power. And so I think about the role that the board played with HPQMC and the good work that the Equity Committee did there in bringing forward the community voice. That was essential to, I think, getting where we wanted to be, where our state needs us to be. We need to create backstops for ourselves should we have hard decisions coming towards us with 889 and these other efforts. And so I'm interested in taking maybe some of the questions today, or making sure that we are explicit in our deliberations, like how will this move forward our goal around health equity? How will this lower the price of care for low-wage Oregonians? How will this, like, that we explicitly ask ourselves those questions and make sure that there is an answer to them that we see reflected? Even though, like, right now, I'm like, of course we'll do that. But I don't want to assume. I would like to build it into the process.
It's a great comment. Oscar, please.
Yeah, kind of with what Kirsten was just saying, that kind of makes me think of something that Leanne mentioned earlier about some sort of a lens, right? In terms of like how we make decisions, in terms of like, is this helping us achieve our like 2030 goal? Is it neutral or is it not? So like something, you know, very high level and easy to say, if it doesn't help us like move in that direction, then it's a no-go. I think the other thing I want to just make a comment about too is a lot of our conversation thus far around health equity, I think, you know, has been centered around race. I want to make sure that we're also thinking about tribal communities, and also figuring out how the priorities that we're going to be focusing on are not just we're not just checking in with communities of color, BIPOC communities, but we're also centering tribal voices. And then the last comment I'll say too is, you know, I feel like in a way, like we mentioned this, that like the committee work is like is also a priority, right? Like improving the infrastructure of the committee work and improving how the committees connect. And I'm wondering, like, who owns that, right? Like somebody's got to own that, because if we are going to say that is important, we probably need like, you know, somebody that is focused on ensuring that this intersection of committees is happening, that it's intentional, and that the committees continue to be reflective of the voices that we're trying to like advocate for. That's a resource allocation, that is a resource redistribution, and that's like strategic and intentional.
Great. Oscar, I just wanted to sort of test something with you in terms of making sure I heard it correctly, that based on the conversations that I've heard you all have, is it the board's role, or are you thinking there's another piece there, that the board's role to sort of make sure that's happening? Or are you suggesting it's more of a staff role? I just want to be sure that we're capturing that.
I think it's both. I think we can, we can encourage that and guide that and potentially like check in on where that's at. And I think it'll also be like a staff thing in terms of them figuring like, well, this is what the budget impact looks like. And, how do you help us kind of how do we make that happen?
Got it. And it may be, as we talk about wrap up and next steps, I mean, I think one of the things you asked the staff to do yesterday is to come back and say, how are we going to make sure that cross-cutting communication happens? And maybe the idea I think you lifted up yesterday around, is there are there some sort of charges to all committees that there's some consistency, and is one of those charges equity, equity must be central, or you must consider that decision framework. Is it neutral? Does it move you forward? Does it move you backwards? Maybe there is some consistency that you want across committees. At least that's some of what I heard you all say yesterday. Can I also wonder, Oscar, is that, and this is to Kirsten's point too, you have those decision-making principles that we revised and brought back to you. And I wonder if you might want to sort of bring that question about when you are making decisions, you want to be considering what the equity consequences are, right? That maybe that even though those principles are more on process, but this feels so central that it is part of your process, right? So I don't know if that's something that you all might want. How do you keep bringing this forward so that it's always in front of you? Just a thought. Additional comments or questions on this before we wrap up this piece of the conversation? So I want to sort of ask the same question. I think it's more sort of, not complex, but sort of it is throughout all of your work. It's not like 889 and the waiver renewal and then equity. It's woven throughout. But I want to be sure that there's some shared understanding here. And it was sort of to David's point earlier, which is this focus that the board will continue to lift up equity, but and particularly in the next year, focus on 889 and the waiver, and in sort of conversations and oversight of its committees, that would be the focus. And obviously there's going to be other things that come up, right? And then also the things that you're really interested in, at least informing some of this, is what are those lessons learned from COVID? And what are those lessons learned from the health authorities' work and the HEC and the RJC? What are those pieces that you all should be knowing about and considering as you do your work in the next year and beyond? So does that resonate for folks in terms of some of this work on equity focused on 889, the waiver, the committee work, and obviously informed by what's happening on the ground? Does that resonate? Is there anything missing there? Or anything wrong? Does it resonate or miss the mark?
I think it resonates, and thinking back about the conversation yesterday, as we were kind of talking about like how do we thread the needle in terms of all the committee work and all the efforts specific to equity and an anti-racist lens. I think the more that we continue to operate from kind of the framework roles, I think more clearly see today, and I was tired yesterday, kind of, what our various responsibilities will be, because I feel like at different times we're going to be a collaborator versus a communicator and supporter. And so it's really looking at kind of, how do we also support HEC so that then it's not just on HEC, or folks are not, everyone's not relying on HEC. And so, you know, I think there's that balance. So anyway, so I think, you know, I'm looking at the roles in front of me. And so, you know, that was like my little aha moment. So it's just a little bit more clear today.
Thank you, Ebony. Any other reflections on this? Go ahead, Brenda.
I just want to make sure that I'm hearing your question the way that you're intending it, Diana. And is that to say that, I mean, clearly we have 889, we have our waiver, and we have our health equity buckets, you know, of attention for this upcoming year. And I think I heard you add the fourth bucket, which is our own development in our committees and the relationship among committees, the way we're seating committees, the way we're educating ourselves, the way, you know, that's a fourth focus for us, because I'm hoping that's yes, and I just want to make sure I heard it, or maybe I'm hearing it. Yeah.
I mean, I think, and let me be sure that I think, and matters what you guys think, but when I do think of these, your areas of focus, it's 889, the waiver, equity, and your committee work. and that all of yesterday, like that it's oversight. I mean, there's no way that you can be in the depth that the committees are. You guys, you just can't. But that oversight role and that equity, and I was sort of lifting up that equity, that one of your roles in that I heard from you all is that your focus on equity has to be in that committee work as well, if that makes sense. That is one of the questions. And I think Oscar's made this point throughout, like, what are the, you know, how do we thread that, whether, you know, that understanding what all the committees are doing on equity and how they're lifting it up. And that's to Trilby's earlier point. So does that get it, Brenda? Is that clear?
Yeah. And I think maybe I'm taking a broader definition of development, because I was hearing things about how the board and the committees relate to each other, how they're informing one another, how much community engagement is actually happening, you know. So I was kind of moving it in probably broader terms than just the committee performance, but it's all the connection points. Yeah.
Yep. Okay. I want to then this is really appreciate everybody's sort of input here, and you know, all of this is, you know, this is work in progress. You know, I mean, I feel like where we want to land today, and we have one more piece, is, as I've said, this sort of shared understanding of the work and of your roles and responsibilities in 889, in the waiver work, in equity, and the committee work. And I think we're getting there. I hope we're getting there. And we'll talk sort of as we wrap up in a bit around sort of some of the next steps. I also am going to hold some time for this conversation about board recruitment and gaps and needs. Just want to make sure we have a few minutes for that before we wrap. But this last conversation that I'd like to move us to is focused on sort of past priorities and what happens with this work. We talked, you know, you've said that you know, you have a desire to hone in, look at those North Stars. In a number of conversations, folks have raised questions about the 2020 work. What happens with behavioral health? What happens with CCO 2.0? What about COVID? I want to say, I think that we had a fair bit of discussion about behavioral health this morning. And I want to see if there's any outstanding questions about that. But I feel like, so that's the first thing. We also talked a fair bit about COVID, as well as CCO 2.0 and the importance of CCO 2.0 feeding into the waiver work, particularly. But wanted to sort of make sure, and there was a document in your packet about past health policy board priorities, but just wanted to sort of see if there are, from the board's perspective, any outstanding questions here. Like, what's going to happen with X? What's going to happen with Y? What are we doing about that? So wanted to ask all of you that as we start wrapping this up, so that the staff can come back to you with, this is what 2021 looks like. And some things, and this is, I mean, I work with groups all the time on this, the thing that makes people most uncomfortable are the things that aren't on the work plan or aren't on the calendar. Like, but what about that? But you can't do everything. You just can't. and no groups can, especially if you want to do it well. So I don't want to just leave that out there, but really wanted to make sure that you all felt clear about what's happening with X, Y, and Z. So I wanted to open it up for that conversation. If there's anything you want to raise or anything that doesn't feel clear at this point. Let's start. I'll maybe take it. Oh, David, please.
Yeah, let me just say, I feel much more comfortable today in terms of the COVID work because we know what needs to be done. The state's doing it. I think we're really, that conversation was really helpful. I think in real time, however, there was a lot of uncertainty because this was a new pandemic and we really didn't know exactly how it would play out. And we've all felt a fair amount of responsibility to contribute and be involved and work with OHA. So it's, in retrospect, it worked out great, but in real time, that uncertainty, I think, was real and is, and we just need to really hope there's not another pandemic over the next 2 years, a new challenge. But, there always could be a new challenge. I think, we should, as new challenges emerge, say, okay, how does the board address new challenges in real time?
Thank you, David. Go ahead, Brenda.
This has been up for me a bit, and I've been thinking about my time on the board and when we've had conversations in the past and how to keep, I have a personal watch list, like the kinds of things that I actually remember and I bring forward and I bring forward again and again. And then I wonder about whether or not it would suit this group to develop a collective watch list. The kinds of things that we all care about that we may lose track of over time if we're not intentional about bringing it forward in some mechanical way. Because left at my own devices, what I care about may not be the same thing that everyone else on this board cares about. And it may seem, distracting to OHA staff for me to bring it up. But the kinds of things that as a group, we might say, hey, we really want to be on the lookout for this. We know that it's emerging. We know it's not on our work plan, but it's a really critical element that we keep track of. How do we mechanically go about that as a group? I don't know that we've done that yet, at least not on my time on the board. And so it would support my ability to let go of past priorities if I knew that there were certain pieces that were being tended to in some other way.
Yeah, I agree with you, Brenda. I think I have the same sort of feeling. And I think for me, I'm anxious to see that strategic plan, right? And whatever doesn't end up, we have our priorities for the next couple of years, but I want to see the strategic plan and see behavioral health in there, right? Or see other things called out that we may not be able to sort of be focused on for the next 2 years, but they're going to be a huge part of getting us to 2030, no more health inequities. So that's from.
So just so I'm clear, ask for the OHA strategic plan, wanting to see the health authority strategic plan. Got it.
Yeah.
Other thoughts about the idea of a watch list? Kirsten?
I'm not sure I have additional thoughts, but I like it.
Okay. Others? Anybody not like it? Or anybody think, so I'm gonna say, yeah, I see John liking it. And I think, so here's the, it could be, I think as long as it didn't distract you all, right? It seems to make some sense, and it could be, sort of going all the way back to this morning's conversation about behavioral health is, are there sort of educational webinars, and I heard from all of you that you really like those webinars, right? So are there opportunities, again, being mindful of the demands on your time and the requests for your time, but are there some of those things on that watch list and that we want to get an update, so that there's an education. We want to get an update on whether it's, behavioral health or something more, specific around behavioral health, or what's happening with, we worked on children's health for, what's the latest on that? Can we get an update? So I think you could have something like that, as long as as long as it didn't distract you too much from, I think it's hard, sort of the discipline around doing the work, but also not siloing yourself, right? Because we know behavioral health is really important in this other work. And so you don't want to say, that's not on our priority list anymore, we're not going to pay attention. So I think, so I want to ask staff if that's something that, based on these conversations, that is something you could bring back. Oh, Kirsten, please.
Can I also just highlight, just because I know that those webinars, I do really like them, by the way. I also know that they probably are not a small amount of work. So I also think this could be like, what are reports that you are already doing, or maybe in that other sphere, you are already doing some sort of webinar or something where it's just like a, hey board, in case you're interested, here's this. So we aren't creating new work for you.
Yeah. John.
Yeah, I think a watch list is great. I do love the education sessions, but I'm sure they're a lot of work. I think for some of the issues on the watch list, if somebody let us know, hey, there's a significant meeting that's going to be taking place about the children's stuff. Mm-hmm. Like I'm pretty sure I'll find out about that because they keep coming to HPQMC and metrics and scoring. Or even if something on the watch list, it turns out there's been a really interesting meeting, if somebody could give us a heads up and say, hey, you might want to, look at this recording. I mean, I've watched a lot of recorded meetings, and, they're very helpful if you're really interested in the topic.
Sylvie.
Yeah, I just wanted to say that, I appreciate the concern for the work in the educational webinars. Thank you. Often it is a presentation that we can bring to you all that has been used in some other setting. And so really capitalize on work that's been done to make sure that the board is up to speed and has that deeper dive that can really help you then, I think, as you continue the work during your meetings in your priority areas, weave in what's happening in behavioral health, stay current on that, and make sure it's integrated in the right way. So I think this has a lot of potential to have that watch list and try to address it through educational webinars and references to other meetings. Sarah's tip for HPQMC, having this important meeting coming up where they get the ask from the 889 committee. That's the kind of meeting that could be really important for folks to attend or listen to as it's recorded at some point.
Okay. What I want to do is to see if there's anything else on this sort of what about the other work, because I think we've sort of talked about this morning behavioral health. We talked about COVID. We talked about CCO 2.0. Anything else you want to lift up before? I want to shift us to a conversation about the board recruitment piece, but I also want to wrap up where we are before we do that. So it'll be like a little add-on onto the agenda. But let me see if there's anything else in terms of the other work, any unanswered questions at this point. Okay, so what I thought I'd do, oh, Leanne, please.
Thank you. Yeah, it's not a question, but I just wanted to share, especially given the conversation around the strategic plan and the work and the different pockets of work, that, and Pat has said this, I think, to some degree as well, that we have much of the work and functions in place that will move us towards that 2030 goal. What we've got to do is figure out how to figure out where the gaps are, and also take down the resistance to that work. So we counted about 30 areas within OHA, 30 functions that are leading us towards that 2030 goal. 16 of those functions exist within the Equity and Inclusion Division, in addition to Tribal Affairs and Community Partner Outreach Program and a variety of other efforts. So we're looking at how all those flow towards 2030, and I think that those areas are areas that kind of lend itself to reporting out around what progress is being made in the specific discrete areas and how those are all flowing together to get us to that 2030 goal. So just wanted to let people know that that we have a lot of what we need in place. We just need to figure out how to better organize it, get resistance out of the way, and determine what the gaps are to get us there.
Thank you so much, Leanne. Oscar.
I guess I will do a little bit of, I just want to, I sort of kind of have the community perspective because I'm not working in public health on a day-to-day basis. When we did the COVID presentations from communities, particularly the communities of color over in 2020, we heard pretty much like almost every single presentation. We need a plan. We need a response plan. We need a culturally specific plan. We need to see where we fit in the plan. So I just, when I'm talking about the strategic plan, I can understand how it can be really challenging to sort of be able to provide this like document, right? But I think ultimately we're talking about transparency and accountability. And I know that OHA is a really, really large agency, super, big budget, very complex, so that you wouldn't be able to easily provide like, here's where our strategic plan is in this website, right? But I still think that we need to be able to see what are some of these things, big bucket items and big bucket goals that help us get there. So I guess I would just sort of like say, I would encourage us to try to actually get to a place where we can see something like that.
Thank you, Oscar. Brenda.
I just love that so much, Oscar, and I think that maybe us also really holding some tension within our own committees could be a place to really model that and demonstrate that. And as we define, we're asking that of the agency. We heard from Pat earlier the complications of it for all the right reasons, and that we can also just keep moving in our liaison roles or with our board role to ask the committees to help us identify an integrated plan, at least there, and it may not be agency wide, it may not be all the other stuff, but let's start close in, so to speak. Yeah.
Okay. I said I was going to wrap things up and then talk about board recruitment. Let's wait for the wrap up till the end. So let's actually have this conversation, because it is on a continuum with all the discussions we've been having, because what you've been talking about is really obviously the work you're doing in 2021 and what's important to the board and the state as you do that work in order to move transformation forward. And so earlier in the conversation, it came up about, as you bring on new board members, which hopefully, it sounds like will be happening soon, at least I don't want to say because I don't know, but soon. But what are some of those gaps and needs that you all see in terms of, given the discussion, the conversation you've had over the last 2 days, what do you want to share with staff and I think the governor's office about, here's where some of the needs and the gaps are. And it doesn't mean the 6 of you aren't amazing, because you are and bring so much, and there's only 6 of you. So, what are the other things that you think it would be great if we filled this gap or this need, or, here's some of our perspective on recruitment in terms of liaison. So I'll stop there and just see what feedback you'd like to provide. Sorry, John, why don't you start?
An economist, and preferably an economist not from industry, as 889 is a complex economics issue. You know, John McConnell was on 889, and I bet he was really helpful. John's done diversity work, and I know he probably can't be on it because he's works for a health organization, and so you know, someone who had an economics background, understood those issues.
Great. Other thoughts? Brenda.
I hope our recruitment is focused in tribal communities. I think it'd be really fabulous to ensure that we're always relating our recognition of the governmental entity that the tribal organizations have and possess, and how that intersects with our work.
Thank you. Other feedback, board? Brenda.
I don't know. I mean, I think our continued work in demographic diversity is really critical. We're asking, and I think somewhere in our materials, we saw the survey results for our committees in terms of diversity. And I think that's helpful. So where we're embodying that as well. I think lived experience is always incredibly valuable to bring to any group. And I know we haven't yet done that. I think we do it by channeling voice, but I don't know that we actually always think about how to bring it in the room.
Thank you. Okay, so this got some good feedback there. Obviously, this is not your only opportunity to provide feedback. So if there's additional thoughts that come to you all on this piece, and then I did hear that just throughout the conversation that you all would love to be kept abreast of the status of recruitment and new members as when OHA knows it, because as Jeremy shared, it's in someone else's control, but to the extent that they have information about it, that they'll share that back. What I'd like to do is just sort of sum up very broadly some of the things that we heard over, you guys discussed over the last 2 days, and then we'll have just a few moments for any additional reflection or comments at the end from all of you. And then close with giving David and Oscar time to close us. We started yesterday, and really what the goal of these conversations was to sort of have some clarity and affirmation of the board's roles and responsibilities and a shared understanding of your 2021 priorities. And we talked about, I mentioned sort of what a retreat is, and it is sort of trying to step back and look at sort of what's on your plate and where do you want to sort of hone in and focus. And so that board discussion was truly, I mean, there's a significant body of work there, and that oversight that you have is a significant body of work. And there were, hearing from everybody, I mean, some of the big themes heard this again and again from you all, that cross-committee communication, and what are some concrete ways of ensuring that. And so I think that's one of the things that will come back to you all in March, is sort of how do you make sure that's happening, number one. Number two is, just how do you continue to support and encourage those committees as they sort of center equity. And then so that's another piece. And then another piece is sort of how do you see that big picture of the work that they're doing and the work that you all are doing in terms of transformation, and specifically 889 and the waiver work. And I'll come to that in a moment. So that committee work, I think there were requests of, here's how we need support from the board, from the committees. And I think there's a thought that will be pulled together in a document so you can see it, not sort of spread across the committees, but in one document, all of the asks of you. And how are those going to be teed up in terms of 2021? And then today and yesterday afternoon had some really, I think, helpful conversation about what is thinking across committees and what are the expectations across committees. Talked about the liaison role, and I know that there's still some to sort out about who are going to be the liaisons for different committees, and especially with some new board members coming on eventually. So, and that nesting of different committees together. Also, today really focused on 889, the waiver, equity throughout, and hope that you all have some shared understanding. And again, there'll be something that comes back to you about sort of what those roles are: leader, collaborator, supporter, communicator, and what that looks like in that work, and in sort of focusing and centering equity in your conversations with committees, as well as that work on 889 and the waiver. And the other thing that's come up a few times today, or today and yesterday, is sort of that this idea of the partnership you all have with the health authority. And that feels important, and wanting to sort of have them weigh in and importantly learn from some of the activity, and what are the lessons from COVID especially that will inform and really can help your work in the next year. And then we did just talk about some of the other work and where that's going, where that's going to live. And I think, again, this is in the interest of helping you all hone, focus, prioritize, so that the state can best benefit from all of you as a body. And how do you continue to move that transformational work forward? So March will be a time for follow-up. I'm sure the staff is sort of already figuring out what that agenda looks like to bring back to you, and to make sure that you're having, I think this is really important because y'all have said it, and I hope you feel like you did it in the last 2 days, is those robust conversations amongst the board, and not just listening and sort of sometimes reacting, but also sort of proactively engaging in maybe messy or uncomfortable or difficult conversations, but that's okay. And to some of that push and pull. So I, again, hope y'all feel, and it's always more clear for me when there's a written document, so there will be written documents, but I hope that you all sort of feel like you had a chance to step back, think about the work, and think about moving forward. And then I'm going to stop and turn it over to Oscar and David, but to just want to thank you all. I've had the great privilege of working with the board for many years now, on and off, and it is always inspiring to see the work that y'all have done, and the possibility and your commitment to the folks who live in this state. So thank you so much. I really want to honor that, and say thank you for me that I get to engage with all of you in this discussion. So I'm going to turn it over to Oscar and David. Thanks.
Oscar, do you want to start off?
Sure. I just want to thank the OHA staff for all your work putting this retreat together. I know how time-consuming and how hard putting virtual retreats is, so I really appreciate all the work that went into this very thoughtful approach. I want to thank Diana as well for being such a great facilitator, and all her work leading us through the retreat, and even before the retreat, getting us prepared. And I just want to thank our fellow board members as well for your attention and your your time in doing this work, which I know is a lot. And I also just want to thank the community of volunteers who are doing really great work in the committees, on a regular basis, just because they believe in what we're trying to achieve here. So thank you all so much.
Yeah. Wow, what a couple days. Anyone feel the need to move a bit? My gosh, well, yeah, I just add my thanks as well. I mean, I think I'm leaving these last 2 days with a lot more clarity about how to move forward. And with that clarity comes courage to pursue, I think, our bold initiatives. And I feel, both that clarity and courage has been notched up a lot over these discussions. And I also want to acknowledge that clarity and courage comes from the great work of all of you and our collective discussions, but also comes at a time where we did this all by Zoom. And we just got to acknowledge this is more work by Zoom. It's not as much fun as being in a conference room with y'all or on a retreat in some distant part of Oregon. So it is a lot of work. It is a lot of work for all of us, each and every one. And I think you should all be proud of that work because I think it really paid off. And the thanks are to Diana. Diana, great job. The thanks are to the OHA staff who prepared all this work behind the scenes. Steph Jerem, Michelle Hatfield, Tara Chetcock, Trilby DeYoung, Jeremy Van de Hey, and of course, Pat Allen. And there's so many, all committee members and chairs that presented yesterday were great. Thank you, Leanne Johnson. Your voice is always appreciated here and your leadership. And I think the thanks also goes to our fellow board members, Ebony, John, Brenda, Kirsten. Thank you so much. Oscar, thank you for being there every Tuesday morning to help plan this out. I think it all paid off. And so this clarity and courage is thanks to all of you during this challenging time. I'm really humbled and honored to work with each and every one of you. And I am humbled with this new clarity and courage. In fact, I have so much courage right now that I have enough courage to go to a 2-hour FAB meeting this afternoon. So I'm ready to move forward with y'all. Thanks for y'all, the collective discussion, the input, bringing yourselves and your experience, your knowledge to this, and let's move forward and do some great work together.
All right, anybody else? Anything else? Anything else for the good of the order? And you guys look, we're giving like, I don't know, 12 minutes back. I hope you actually do something nice for yourselves and take a breath, take 12 minutes and go outside, even though it's raining, but do something to take care of yourselves. Thanks so much, everybody. And we'll see you soon. Have a great afternoon.
Thank you.
Bye.